My first error. Good afternoon and welcome everyone to our workshop this afternoon. Delighted to have so many wonderful staff members and several board members with us, and we believe we have at least one more on the way. First error. Good afternoon and welcome everyone to our workshop this afternoon. Sorry. Yeah. As a reminder for all of us, the mission of the Children's Trust, which I just saw stated on page 1 of our new annual report, as a reminder, is to fund and support a coordinated system of community services that allows all youth and families to thrive in Alachua County. I don't know that we have any members of the public with us this afternoon. I see yes, oh, we do have one. Welcome. Any member of the public wishing to be heard is welcome to come forward to the podium, introduce yourselves, and be recognized to have 3 minutes to speak now, or I think we have a later time in the agenda as well. As a reminder, and I'm sure you probably know this, our policy does prohibit any unplanned funding requests from the podium. Should a member of the public wish to make a funding request, please contact the executive director and staff for consideration. Now, could our clerk please call the roll and verify who is with us this afternoon, Katura?
Madam Chair. Tina Certain, member. Here. Sorry, member Tina Certain, thank you. Chair Mary Chance.
Here.
Member Ken Cornell. Dr. Nancy Hart, member. Dr. Maggie Labarda, member.
Here.
Dr. Kamala Patton, member. Treasurer Lee Pinkeson. Honorable Suzanne Wilson Bullard, Vice Chair. Coming member Melissa Walker.
Thank you. So, Director Kiner, I don't believe we have a quorum, correct? If we don't have our newest board member installed. So we don't need approval of the agenda. Okay. So again, this is not a board meeting. It is a workshop. So we'll go ahead and move forward and hoping that Ken will be joining us. So with that, I think I'm going to turn things over a good chunk, at least the first couple of hours. We've been working for the past several months on a new strategic plan for the trust. This is the third, I believe, of 3 workshops with the goal of finalizing a strategic plan. There's been considerable input along the way from board members and the entire team. We're also going to spend some time this afternoon on a topic we've touched on as an important way to sort of gauge our growth as an organization and strengthen the providers funded by the trust, which is the life cycles of nonprofits. And so we'll spend some time on that as well and refresh our memories about what that is involves and review a analysis on where we stand as a trust at this point in our life cycle and have a discussion about that with Tracy Berger. But first, I'm going to turn it over to our friends from C. Robinson Associates. Conchita Robinson, I believe, is with us. Jackie Gibbs and Regine Dennis. Did I get names? Thank you.
Good afternoon. Madam Chair Chance, board members and staff, it's good to be back with you again. Thank you for the opportunity. You have already acknowledged my colleagues, Conchita Robinson and Regine Denis, that are here with me today. And as we begin what will probably be our final presentation as a part of this strategic plan refresh, we want to really express our appreciation for your time as board members, for your partnership, and for your clear direction that you have given throughout this process. Now, as we go through today's session, we do want to note that some of the terminology has changed The layout of the strategic plan has been modified, but we will get more in depth with that. But that is really not unusual as we go through a strategic plan and through a refresh. As I said, as we go through this, we will tell you where the changes are. However, we do believe that we have fully captured the intent and the spirit of your direction, as well as the what you have put forth as we have gone through this process. All right, so next slide, please. I just love those little kids on that slide. In addition to the presentation of the updated strategic plan today, we will also include our history and our background, the framework of this process that got us to this point. And in order for you to get a comprehensive picture and time frame of the work that's been done, we have broken this really into phases that you see here on the screen. So there are 7 phases that we will talk about. And I want to go through each one of those just to give you kind of an overview of what we did in each phase. Phase 1 was our prep for the strategic plan refresh. That was our listening sessions that we held with the board back in June and July of 2025. Can you believe it's already 2026? Happy New Year, by the way. And then phase 2 was we brought the board and the staff together to really align on the purpose and the direction and the priorities of the strategic plan. Phase 3, staff went to work and they engaged in these work sessions to convert the board's direction into updated strategic content. Stage 4, we came back to you. So this is the follow-up workshop with the board to confirm the alignment and the refinement that that the staff did for the strategic update. Then staff went back again and completed the final alignment work to ensure that the refresh plan could be implemented and monitored effectively. And that brings us to today. And today you will see the refreshed strategic plan, and also Belita James will do a training update on the meta training that you all are currently doing. Then we will talk about next steps. Next slide, please. Just to dive a little bit into the background, phase 1 and 2, as I said before, June and July, we met with board members individually to get your stance and your perception on where the trust needed to go. We then brought you together in July, staff and board, and we made some minor tweaks on goals 2 and 3. And in addition to that, we talked about creating a 4th goal. So we looked at your mission, we looked at your vision, we looked at the guiding principles and your goals. We did a SWOT analysis, as well as a visioning for the future exercise and priorities ranking of the goals and considerations for future goals. So that was phase 1 and 2. Phase 3. That took some time. That's where the staff went to work after your direction to them. So phase 3, really staff engaged in translating your direction, in reviewing the indicators and establishing impact measurements for each goal. And they designated the providers into life cycle stages. They established what the new goal, the 4th goal of capacity building that you directed, should encompass. Phase 4 and 5. This was your follow-up board meeting. In that board meeting, you really stressed the importance of starting from baselines and determining what those baselines were. You talked about prevention and evidence-based criteria. You talked about the importance of meta training for our providers. You also talked about the RBA, results-based accountability, and how important that was in this new strategic plan. and you gave the staff some latitude on the financial funding criteria that they were to be working on as well. So staff refined and adjusted based on that direction. And they even came back to you in December with an additional survey to confirm the safeguarding of the community indicators to be measured. Remember, this is not your first strategic plan. You started this plan in 2023, and this is a refresh, and you had community indicators in that first plan. So that survey really just said, what do you want to keep in terms of community indicators and where we go from here? So to making sure that what we're going to add is aligned with those focus areas. So today, we're going to present the focus areas for goals 1, 2, 3, and 4, the objectives. We have put together some strategies that the trust will use to meet or exceed those goals, and what will be measured or monitored on the community level, on the program level, and on the system level. So those are your impact measurements we're talking about. So let's dive into each goal, the updated objectives, strategies, and impact measurements. But before we do that, I really want to share how staff approached this final refinement draft. So what you see on this slide is an effort to ensure that the plan could be monitored consistently. Staff strengthened its goal monitoring and outcome measurement structure using results-based accountability, which you had in the past as a board had already adopted. And this framework reinforced availability at 3 levels, and I mentioned those before: the program level, the system level, and the community level, to meet the goals of, there at the bottom, healthy and nurtured, educated, safe, and CTAC-funded organizations serving our youth are equipped and empowered to do the work. So that's your capacity building 4th goal. Now, this is what that last survey was all about that was sent to you in December. Because this is a refresh of a plan, the plan that you established in 2023, and it runs through this year, staff wanted to know your stance on the current community indicators, as well as those adjusted indicators that we will be bringing forward today to align with the focus area for this 2027 plan. So what you see there are the 3 areas for the first 3 goals in terms of those survey results. This really is just the definition of some of the terminology that we will be using going forward. Objectives is what we're now using where we previously used indicators in order to not confuse with community indicators, which is what you used in the RBA framework. We added strategies as well to help support the RBA. So we've changed what we formerly used as indicators to objectives. We've added strategies, and we've added impacts on 3 levels: program level, system level, and what's the third one? Program level, system level, and community level. Correct. I lost that for a minute. All right. So your 4 goals: children and youth are healthy and have nurturing caregivers and relationships. Children and youth can learn what they need to be successful. Children and youth live in a safe community. And to line up that 4th goal of capacity building with statements like the previous 3, empower and equip our provider community. So those are the 4 goals we're working with. Any questions so far? Okay. We will show them as we go through each of the goals, yes. And if you have questions related to each one of those, we'll be glad to try to answer those, yes. Other questions? Okay, so your first So your first goal, children and youth are healthy and have nurturing caregivers and relationships, has 4 focus areas: maternal child health programs, infant and early childhood health, comprehensive health, and children and youth with special needs. So we'll go through each one of those. So the first one, maternal child health programs. The objective here is parents are mentally healthy and supported. See on the side there, the community level indicator alignment. These alignments, these indicators align with maternal child health programs, and they are the community level indicators. Under that, you have the strategies that will be used to reach that goal or exceed those goals. Provide maternal mental health direct services supports, provide navigation to connect new parents and services and resources, and provide parent education to support learning and community building. Now you have the performance measures at the program level. Think of that as your indicators at the program level. Have a baseline. You had a baseline, current baseline of 100% because you were measuring 2 of the goals there. We have added, staff has added 4 more goals under this area, 4 more levels of measurement under that area. And because of that, we have a system level impact of 80% of performance measures in this focus area will achieve or exceed the goal. And that's how you know you're making your impact. Okay. And I also have Amy and Bonnie here that will help field the technical questions today. So if I can't answer, I'm sure they can.
So one of the questions I remember we asked at the last meeting was, and you alluded to a baseline of 100%, which why is it here? But so where are we? And what is the target? I mean, I think I'd like to be able to see that because as I see reporting from staff, I want to be able to know where this is where we started, this is where we've gotten to. And I'm not sure how something that's already at 100% something that we want to address and set a goal for. So Bonnie, I don't know.
Well, I will say maternity child health programs were one of your top priorities that you
Right.
voted on the last time.
Right. No, the area is important. I just want to know what we're trying to move and from where to where.
Okay, gotcha.
What specifically are we trying to move? Where is it now and where do we want it to be?
All right, Bonnie.
So our performance measures in that bubble, there's 6 of those are examples of what might fall in as performance. And looking at our system level, those would each go our system level impact. They're associated with achieving the objective of parents are mentally. Actual performance measures are just examples of what could be in a fiscal year. We'll have additional programs, but all our programs are focused on that objective. How are they doing? Are they meeting their targets? And if they are, then we are successful as a system in acting that objective. And
I'm still left where I am. I mean, I want to, what is the current percentage of depression, postpartum depression, and where do we want it to be at the end? Because, yeah, if these are the measures that we're expecting our programs to get to, then I want to know where are we? You know, we may have 5 or 3 or 2 programs in a given area. What's the starting point? How many depressed postpartum depression moms are we seeing, and where do we want to get it to? How many people had questions? How many? I mean, it just seems to me that this is very high level and not at all numeric.
there's the community level indicator level measure on maternal mental health. That's how many women have, according to the Healthy Start, depression symptoms during pregnancy. And then that, and in order to affect that, we invest in programs with the objective that parents are mentally healthy as a way that they're trying to.
I understand that, but at our level, we're not seeing a here to here kind of measure. And I think that's what I want to see is I need to know where we're starting, where we're going. Because if something is already at 95%, I'm not going to pay as much attention potentially as if I've got something that's at 60% and we want to get, you know. So, yeah, I kind of, to me, it's hard to know where we're going if I don't have a starting and end point.
So the reason it's 100% is because out of these performance measures, we only currently are measuring 2 of them. The other ones are new for new programs for this year. And so for the 2 that we are currently measuring, we are currently achieving those. And for example, parents receiving doula care with no low depression symptoms at 6 weeks, we don't have a baseline for that in terms of depression symptoms of moms that we're supporting because we didn't fund that in the last fiscal year.
But that's an internal, that's not changing a baseline measure. So if what we're saying is the data show that, and I'm pulling a number out of a hat, 20% of women experience depression postpartum within the first 6 months. That's the data that's out there. We think that our moms are going to do what? That's the kind of targeting I want to see. To say that 80% get better, well, yeah, if you went from 10 to 11, is that significant? I don't know.
Well, it's not saying all of these are not 80%. It's saying 80% of these measures meet.
Okay.
But we create the measures based on programmatically what the program is planning to do. We work with the program to set the target.
But from where? Again, what we want to do is move that community level needle. And so if the general data from Florida, my Florida charts says that 20%, what do we want our doulas to get to? 15%, 5%? Otherwise, I'm not seeing how we're moving the needle. Simply to say that 80% of our programs or our performance measures will achieve or exceed targets doesn't help me know exactly what it is that the impact we're having is. And I may be alone in this, and if so, let me hush.
Dr. Hart, you had something?
Yeah, so I kind of third party 30. What the trend has been over time, bubbles up and down and up and down. I got stuck. Is on infant mortality. Thousand is very low. So if somebody has quadruplets and they die, it's going to look horrible. Low birth weight of birth are very well connected to I would totally back some years and see where act in swag we reduced them a bunch. All those mothers moved out and new mothers moved in. So in other words, we need to know the wobble and it's the taxpayer. It's your tax.
Exactly. Exactly.
So in addition to contractual requirements, you're looking for our team to include individual gains, the family level.
The way I look at strategic plans is it's a hypothetical statement of if we do X, Y happens. And so why that happens is something improves. Well, then in order to know it improved, I need to know what the starting point is and I need to know where we got it to.
Okay,
What-
I
for
understand
each-
what you're
but-
saying.
Yeah, so if a program doesn't do anything related to domestic violence, that may not be something we measure for that program. But we want to have clearly, what we're saying here is we want to have programs that impact domestic violence. So for those programs, comparing to the general population, what happens with these moms that get involved with us and these kids that are involved with us? But we need to know a start point and get to point. Because for me, partially too, again, if you move something from 80% or, 1 out of 8 to 1 out of 7.5, that may not be a change that I'm going to be excited about. And if we move it from 1 out of 7 to 1 out of 20, I might in fact be really excited about that.
Dr. Labarda, in the community, postpartum depression might be 12%, but 100% of the women that come in for services for postpartum depression are going to have postpartum depression. So seeing that go down is an impact that would the community level.
We want to see those numbers, Bonnie, is what I'm saying.
No, I mean, those numbers for each of those, we didn't report on this, but that's the idea of the reporting part of it. When we get to it, we would report on those numbers on the performance measures, how many parents receiving the care had reduced symptoms, how many improved because of that. But we know that coming in our doors, they're coming because they're seeking help. So they're going to be worse than the community level indicators. Same for maybe the school indicators too. The kids in our programs are more at risk, have more disadvantages. So they're not going to be at the 3rd grade reading level of the county overall. But we know that that's how we're impacting it.
I think there's 2 things you're talking about there that are not entirely the same. One is saying, if you come to us, you will be better. The other is by offering these services, we beat the state or otherwise local average. Those are 2 different impact levels. One is programmatic. If you come to us, we will help you and you will be better. But the other is by having these programs in the community, we impact that community number. And that's where, at those community level indicators, we need to know what it is that we want to accomplish. So we need some number. What I'm saying is this needs numbers.
Because if I'm not mistaken, Bonnie, you have the numbers. They're just not in the report, but you prefer to see them
Yeah, because I know.
included in the report. Gotcha.
And we said, this was something we talked about last time. Lee was asking, where's the baseline? Where are we starting from?
Yeah, I sent
Versus-
us an updated environmental scan where I showed the numbers when I did the survey, when I sent out the survey for you guys to complete on what community indicators you felt we should keep. I looked at the trend. I think I tried to do it around the year that we started as a trust and maybe a year or up until today, so we can kind of monitor if we're making changes. The strategy really being how we're getting at that is we're focusing on it, on these certain topics, and that we really want to invest heavily in these areas, and that the performance measures, that's where we want to see people be better. We know that the people that we're serving are probably those that are in need of this service and help.
And then a level down from those strategies needs to be what kind of mental health supports have been shown to be effective. And that's not something you're going to see here, but certainly as you choose your programs and do that, then you're choosing things that have proven evidence-based approaches that have proven results and impacts on those things you want to do. So you've got a high level strategy, but then if you will, you've got the interventional approach that will get you there. And that I don't need to see here, but I do want to see where we're going from where to where.
So what I'm understanding, I think what I'm hearing is those community level indicators all need to have a specific number attached to them that we're seeking to improve.
Just with the community indicators, you're looking for a baseline, or are you thinking I'm just clarifying, for these performance measures, that potentially are different from year to year, depending on what programs are funded. Are you saying that you'd like to have a baseline for each?
Well, each of those program performance measures relate to a community level indicator, right? And so yeah, each one ought to tie back numerically, and we need to know, because again, if you've got two programs focused on maternal mental health, and one is getting a 10% increase and the other's getting a 50% increase, but in aggregate, this is the impact we're producing. So there's layers to this data, but it's not enough for me, speaking just for me, to just see this is what we're doing and 80% of the measures were better. I want to tie them so that I know what kinds of services are having the impact. Maybe the doula doesn't have this much impact as something else. I think that's the case. I think the doulas are impact, but I want to see where these programmatic impacts are feeding up to those community indicators.
So you're interested in the baseline at a community, when you're talking about where we are now and where we want to be, that's at a community level. And then our vehicle to get there is through our program performance measures? That's what you're saying.
But we need to see numbers for those as well, so that we know which ones are actually making the difference.
Numbers, yes, but maybe not necessarily baselines. Because I think,
Gotta have a baseline.
The baseline to know where you started from.
Well, if it's a new program, your baseline is at matching it to the community.
Right. You're into the program, you can establish a baseline based on your data.
Well, for our program performance measures, we base it either on their historical performance, what data they've collected in the past, what like programs have achieved. So if it's something new to us, that we'll look to see, have they ever collected data before? Have they done in previous data? Or if they've never collected data, what have other like programs achieved in this area? What's a reasonable target? Sometimes we do for their first year target. If we have no idea, we'll set it as a baseline and then we'll set the target year 2.
Well, then what you're saying for the performance at the program individual contract level, it may be a pre-post. You came in with this much depression, you leave with less, right? But at the community level, then it is against those community indicators.
Before we move on, I mean, are we clear on what we want to go back and do on the performance measures?
And the community level.
On the community level indicators, I want to go circle back to what Dr. Hart said. And are we going to consider the revision that she had with the infant mortality, subbing that out for low birth weight births?
I would.
So, because we just kind of leapfrog over that and went to something else. So I want to make sure that, because that's something she's been suggesting several times, that we're going to consider that or we're not. I want to know a stance on that. And I don't think right now, I didn't get like any feedback I didn't hear from staff like, oh, we'll consider that. So I just want to know that.
Survey.
This is the data for community level indicators that I sent alongside the survey. And then I'm going to share the survey results. So we had 5 board members complete. We had a total of 22 responses, 17 CTAC staff, so basically everybody. And then this is how the average ratings turned out for all the ones that we asked about. So kindergarten readiness came up as the top, so it's sorted from highest to lowest rating, where 3 was the highest score, meaning critically important, 1 meaning not as important, and 2 meaning very important. And what we recommended was that the top 5 in each area we would continue with. So because low birth weight kind of came up sort of towards the bottom, and there was 3 that came up, or there was actually 6. These ones had equal scores, so they all got in. But that's Those were the results.
Some of us.
Why don't you show what the board did?
So, tell me about the feedback you got, but I would defer my feedback to what Dr. Hart would say, because she has more background knowledge and more professional knowledge than I have.
Yeah, I
If
absolutely.
my
would
colleague
defer.
here on the board should tell me, Tina, that low birth weight is a better indicator to evaluate the work that we're doing than infant mortality, I would step back and defer to her, what she's saying.
Likewise.
Bonnie, why don't you show what the board submitted versus the combined, because that was the board.
No, but
this
no,
is the
but
first
you're here
time.
to share your expertise, and I was not aware of some of the confounds in the data that you just raised, and that's why you're here, to help us understand.
Exactly.
Yes.
Yeah, and it can be, that's the purpose of today, is to make changes and to go through it and have you all have this discussion. So everything that is being presented today is changeable.
So I guess for me, if we feel that way and we feel that low birth weight is better than infant mortality, there's no need to keep drilling
Yeah,
down
I
into that
agree.
and
We
spend
just-
the
we
time on
just
that.
checked
Let's
it.
just make that revision and move forward.
There we go.
I'm seeing very much.
Yep.
I concur.
Why we got Nancy?
Thank you, member Certain.
That's why we have Nancy, right?
That's right.
Anything else on the focus area of maternal child health programs? Staff understands the direction.
Okay. Thank you.
I'm sorry, may I ask a question? While we are there, because I think that's what Bonnie was initially saying was these are the survey results. What do you guys prefer? Which we just discussed. You prefer infant mortality be removed and replaced. What about the other two? Should we just go ahead and go there now? Because Bonnie has the results of how the survey was completed. And maybe the discussion point now is, let's look at these all before we move forward, so that we can make some decisions now about it.
Yeah, I had asked for the board members, pull up what the board members.
Heard from 5 board members, so we didn't.
Oh.
For our blind,
Yes.
blindness can't see.
Make it a little larger if you can.
Board members,
Trust me, that's not the problem.
Yeah.
first, it was still the results from the board. for board members, low birth weight babies was still closer to the bottom, but, you know, it's subject to what the board would like to see and what we feel like is the most important and impactful thing to focus on. Infant mortality.
I think some of that depends, again, I suspect that Nancy was the only one aware of the confounds within that particular measure. I know I have some issues around the confounds around some of the mental health measures. We each know what we know, and, you know, a lot depends on what goes into a measure.
So why don't let's do the breakdown according to goal. So goal 1,
And I think what we want to ask is, are these okay? And does anyone know of any confound in them that makes them less reliable for what we're trying to achieve?
So SAFE really only had these 5, so all of them ended up staying in. We didn't have as many that fell under that. Domestic violence rose to the top along with verified findings of child maltreatment, youth arrested, school safety incidents. School disciplinary offenses was rated the lowest, I think, among all of the items, but because there wasn't as many that fell in the safe area, but we don't have to keep it.
Do you know?
I don't think the reporting, I'm not gonna say it's not accurate, but I don't know if it's consistent from school to school. So that kind of makes you, we're trying to, someone can get written up and it can be an offense, and when does it turn to a referral? It's just how they're handling it. So Dr. Patton is really trying to, so that measure is squishy.
Squishy, that's a nice word, squishy.
want us to keep that one or go with the 4? Rather than have a 5th in that.
What's the source of it? Are we getting it from the district, the
We
disciplinary?
would be. Because that would be new.
I'm gonna say leave it, and because it may end up being improved enough to be used, since you don't have that many on the same. I mean, the rest, you've got that. That's a good measure. So it's one. I'm not gonna say it's a good measure, but it's.
Well, yeah,
outside
and
of this.
the challenge with the youth arrested, though, is that a lot of communities have gone to patients for youth.
I like
Goes
that.
to flat out arrest. Yeah, I was really happy to see that as well. And so I haven't looked at any of that in a long while now, but it's worth asking whether we want arrested and civil citation data, and if those are available.
Is there civil citation?
There was a large push towards civil
So
citation as
you may
opposed to
get both of
arrest.
those. Yeah, maybe both of them,
Hoping Judge Bullard would be here to provide.
She could, and
little
she may be a
bit.
good person to check with before we just go ahead and add that, to see whether she thinks that that would be a more robust picture.
Well, Dr. Lombard, I have a question. Are you saying that combine those two, youth arrested and civil
Well,
citation?
just you can
Just
keep
have-
them separate, but together, using the two of them might provide a more robust picture of what's really going on in terms of youth interaction with law enforcement and justice system.
On the safe category.
So Healthy and Nurtured has quite a few items that we've looked at in the past. Infant mortality actually was the #1 rated one among the board members that responded. Developmental screening was one that was recommended for consideration this round, and it actually came in the 2nd ranking position. So with that, I would seek data from the Early Learning Coalition as well as our Help Me Grow to see how many developmental screenings are occurring in children 0 to 5, so we can identify any delays early and ensure that they are. Oral health and maternal mental health came in ranking both at 2.4. maternal mental health, the only data that I could find was prenatal. I looked for postpartum. I looked, yeah, the prams is available statewide. It's not available at the county level. I even looked at that HEDIS data. They did not provide it at the county level.
No, HEDIS data wouldn't come out at.
But they have some good metrics on it, but it's not, yeah, it's not available where we can see how Alachua County is doing.
It's basically done by insurance plan.
Yeah, yeah.
All of the insurance plans require providers to report HEDIS. But, which is health education. God, Nancy, do you remember what it stands for? God, anyway, it's a humongous set of measures, and depending on the kind of treatment you provide, you have to report on them, but I don't think it would be available at county level.
They say they're looking into it when I asked, so because I looked into that because
yeah. Those mental health measures, the problem is if it's at all like the youth mental health one where it was self-injury, the problem with that is that data has a ton of, when you start to look at hospitalizations, it's very confounded in the state of Florida because a significant portion of hospitalizations occur at crisis stabilization units, not hospitals, and they're not. So usually it's it can be a significant undercount. If your self-injury was like a couple of little cuts and you were stitched up at the ER and then sent to a crisis unit, you're not going to count as having been hospitalized for self-injury unless they hospitalize you to a hospital that had its own psych unit. And in fact, that's the minority. Most inpatient stays are going to be at crisis stabilization units.
Remember. Maggie, I'm wondering if we shouldn't look at what's on the Healthy Start screen and how we're doing on obtaining Healthy Start screens, because I know there's really good information on that.
Because I know EPSDT data was horrible.
Yeah.
Only 25% compliance with EPSDT.
Well, anything that requires a postpartum visit is fraught because Medicaid doesn't really, did I say want? They don't really want postpartum visits to occur. They put barriers between women who have delivered and that visit, which are ridiculous. And so a lot of women don't get postpartum visits. And that's one reason that Mia has worked heart and soul, day and night, to get the doula programs going, because the doulas can fix that. The midwives can fix that. The OB mobile clinic can fix that. There are fixes that we are all working on, and we deserve a little bit of atta-girls and atta-boys for doing that. But I think the statistic, we have to be careful which one we pick so we can see how good we're doing, because I know we're going to make a difference. I have faith.
I do too, but again, we need to be, that's why this information around what's in the measure and how it's collected is really critical.
that specific one, when it was asked in the survey, it was prenatal, because I wasn't able to find a reliable postpartum measure that's at the Alachua County level. Well, at the state level, they had stuff, but.
Are you all okay with that? At the prenatal level?
I mean, again, what is it? What are they, do you know what they're measuring?
Well, it's the Healthy Start screen, which I think they get a good portion of the women who are pregnant do the.
So it's Healthy Start while they're pregnant, collecting data on mental health issues. I think that maybe, I think with all of these where we have a caveat, it's always good when you do the reporting, footnote the caveat.
There's a full definition associated with each of the
cells
on this thing.
I know, but yeah, I think that's the best we're gonna get, and that's likely to be more accurate than some of the other data out there.
And then, so we like that one. We don't have a whole lot in the prenatal realm right now. So that kind of would put us on notice that we want to get some more stuff in the prenatal realm. So we can see that change.
But this is something our mother baby subgroup could dig into. For you, Bonnie, I don't see why you feel like you should have to do it. I mean, I'd be happy to work on that with Mia. Can do it with Healthy Start screen.
I asked a point of clarification. So that you said developmental screening was new.
Yes.
By that measure, we're measuring how many children under the age of 5 receive
Yes.
findings.
And then relative to the whole population, that would be in 0 to 5 and that, so we're getting that we know we're screening, we're looking to see, yeah, as a percent.
Okay, so do you want to continue to go through each one, or do you want us to take the information you're providing and those adjustments and refinements?
So if we were going to do the top 5,
Bonnie, may I interrupt? So I'm looking at page 9, and we just went through healthy and nurtured. So we're keeping developmental screening. We've added low birth weight. We will be removing infant mortality. We will keep maternal mental health, prenatal care, oral health, and the youth who felt sad and hopeless. Right, everybody? I just want to double check. Okay, so then,
Did we say?
No, youth, that one's off of the annual youth survey and it
Yes,
is,
we
and
did.
it just,
Okay.
yeah, and it just asks what percent of the, have you felt hopeless most days? I don't remember how the question is phrased, but.
But I don't think we get Alachua level data on that YRBS.
We didn't used to because Elijah didn't participate, but I think they do now. Are they not participating in the youth survey?
On the youth mental health survey?
There is a whole risk survey.
it's the Florida Youth Tobacco Survey.
We didn't for a long time, but I think we do now.
Okay.
I think. I'm not, I won't swear to that.
If we are, we have it, we'll have the data. If we're not participating, then they.
Bonnie, do we get that information? Yes.
Yes, we do. This is it right here. We've had it, they've done it, every even year. They release county level results, and that's our data for that one.
It's the, yeah.
That's the Florida Youth Tobacco Survey.
Okay, there's another one that Alachua doesn't do, but they do this one. Okay.
Okay.
It's the behavioral risks, youth behavioral risks surveillance survey. We don't do that one anymore.
Got to know that they actually, yeah.
Okay with that one? With that measure?
Yeah, it's a very specific set of items, so yeah.
So then I think we can move to,
Okay,
we already did safety.
okay.
So if we hit
Goal 2.
educated,
Okay, so children and youth can learn what they need to be successful.
Our top one was reading proficiency, not a surprise to me. We always talk about that in kindergarten readiness, and graduation. Among board members, there was a 3-way tie among math proficiency, chronic absence, and quality childcare. This came up lower, chronic absence came up quite a bit lower among staff, so it didn't come as high altogether. VPK up a little higher for staff, so that would if we're just going to do the top 5, that would just remove VPK.
I would maybe make an argument that 3rd grade reading and 3rd grade math aren't very different. It's almost like a duplication of the stat. And that VPK participation is really important because it is voluntary. And we can influence the population to take advantage of a voluntary program if we make it convenient enough for them to be able to get there and get their children home. So I would argue, if anyone would agree with me, that we can leave off math, relying strongly on reading instead, and put back in VPK.
he's not here.
Wait, I'm raising my hand for response if that's okay with our chair. So part of the staff influential, obviously me being in the financial arena, is seeing the deficiency in math scores. And I understand that we are highly focused on reading and liberal arts, and I have no argument there. But considering the increasingly low standards in the understanding and comprehension of math from elementary age through high school age, through college age, which is leading to a decreased amount of professionals who are capable to handle this in the field, it's quite frightening, and maybe that's also part of that. So I understand how we're thinking about that, but we've also now, and of course, being involved in the school board, you'd be aware of how we're even restructured the way we teach math, that it doesn't even follow mathematical structure. So I understand as a children's trust, we're focusing on the things that will help prevent and nurture youth and adolescents to prepare them for life and to and to make a greater impact. So the only thing I would say is if we combine them, and it's not up to me, you guys are the board, this is just my opinion on the matter, but that's an important impact, and Florida statutes are extremely low on that, and overarchingly liberal arts is superseding mathematical proficiency. Yeah. Oh, beautiful. Maybe Ken will back me up on that argument.
Says it that.
Oh, I like that answer. So although again, you guys are the governing board, so we defer to you, but my feelings on the matter is that we have the opportunity as an organization to make a broad reaching impact. And again, as I stated, with increasing reliance more on liberal arts side as opposed to mathematical proficiency, I feel like that's increasingly important. Yes, thank you for letting me speak.
So let me just respond to that really thoughtful argument. Do we do anything in the Children's Trust that relates to mathematical proficiency currently?
Other than I think we do a couple STEM programs, which would.
Yeah. Yeah.
So Molly, because math was my strong suit and I used to want to be a math teacher. I don't disagree with you, but I am almost, would lean to, because reading is such it is so key, and they can't test on reading and perform proficiently if they have lacking reading skills, right?
There's the story questions.
It is, yeah, the whole passage, you think it was a reading passage versus a math. So it is really, really key that we have these students reading, every student reading on grade level by grade 3. So kindergarten readiness is very important. The V-Pre-K, they don't fund it, and the district has invested a whole lot in it, but for our demographic of students who tend to be left behind, I would set the math aside for the lift in the V-Pre-K and the investment, because I think math would benefit if we have everybody reading on grade level. Because if you're not reading on grade level by grade 3, or you have remediation, you miss all the other subjects. And with intervention of Dr. Patton's philosophy is improving tier 1 instruction across the board all the way, because we're not going to be able to remediate ourselves out of this. So if we really focus in and everybody buys in to really get kids to where they need to be at grade 3, the other subjects will come up if the reading is there.
So as I look through just looking at this, for each of the goal areas, the 3 goal areas, we don't have more than 2 or 3 measures in each, so I don't see any reason to eliminate any of them.
I mean, we don't, if
You have kindergarten VBK on one, and then you've got reading and math and graduation on the second, and school safety incidents and youth arrested on the third. So I'm not seeing like it's like we're not tracking so many indicators per goal area that it's overwhelming. So I don't know that we have to eliminate any, do we? I mean, just.
How about that, Bonnie?
Eliminate math.
Well, I thought
I mean,
Bonnie was saying we had too many. She was saying we're taking the top 5 and V-Pre-K would be left out because it didn't make the top 5, is what I understood her to say.
I mean, it's an argument of, if you focus on too many things,
Right.
the focus kind of gets.
And I agree. And
out.
we have like 5 things on one
But
goal area.
if we want to focus on a lot of things, I think that's sort of the argument for that.
I'd like to just quickly welcome Member Cornell and then chime in a little bit with due respect to Molly and the importance of math. we're a community trust, and I could make the case that chronic absenteeism should be bumped up because that is a community problem where I believe we have more potential in our locus of control than math instruction.
And attendance impacts everything else. It is, but as I said to us in a previous meeting, is we got to figure out like why the students are out of school, especially at the elementary age level, because those children are where their parents take them. And so I don't know if it is transportation, if it is illness, if it is childcare, like, because that was a lot that was happening during COVID. Fifth graders were staying home to keep younger kids, you know.
But I would.
It does
I
impact.
think we could
kids.
see that it's a community problem. So once we know those answers, there's more potential for us to have impact than I think math instruction.
I mean, if we had to lose one, I think math instruction would be the one I would lose. And I undergraduate math major.
It's not, it's
My
not.
undergraduate degree is math. I love math, but
Listen, you guys are the board. I'm even still brand new. That's just me talking, but I appreciate what everyone else is saying and respect
they do
that.
highly correlate. The two highly correlated, so.
Of course, high school graduation.
And how about high school graduation? That was one that rated high from the board member survey.
You gotta keep that one, I guess. I mean,
We gotta
it's-
keep
it's you can manipulate it, but I'm not gonna get too jaded on it. I'm gonna, because you gotta have that to go forward.
Got
Back to this presentation as opposed to the one Excel spreadsheet. So now we're on page 17. Goal, children and youth can learn what they need to be successful.
Yeah, I was gonna say to you, I'm not sure how that we would fund a program directly that would impact attendance.
I think you go to certain schools that are doing it right and have that principal and staff explain how they do it right. I remember Duval had a walking school bus.
But that's not, we're not funding that. We're not, you know what I'm saying? Like,
No.
we're putting this in our strategic plan and.
No, but if we wanted to fund such a program, we could, you know, if we found that somebody was doing it right, we could grow it. That's what we're here for.
The statute, not directly through the school, we can't. Sorry,
But
I didn't write the statute.
But other trusts and campaign for grade level reading do fund things like laundry services. Other things that are barriers. So I was just throwing it out there for that, but we have member Cornell who'd like to speak to the topic of math. And then Executive Director Connors let me know there's a member of the public who would like to.
Thank you, Madam. Thank you, Madam Chair. I'm sorry I'm late. Thank you kind of for canceling the rest of my afternoon. Yeah, so I apologize for that. On the high school graduation, very, very important, but to what I just heard somebody say, the school board is primarily responsible for that. I don't want to trade that out. I think math proficiency is a higher priority for me than high school graduation to fund. Same kind of idea with VPK participation. We have state program that we are not going to supplant. We're going to try to enhance. And so I agree that also should not, in my opinion, have a higher priority than math proficiency. I mean, I think, and Commissioner Pincus is not here, I'll be his voice today, but he was the one that said, you know, writing and arithmetic. And I agree with member Certain about you got to be able to read, but you also got to be able to add and subtract. And that is important. And as the CPA on the board, I don't want to lose that one. I think that one's really, really important. So some people are really good at math. Some people are really good at other things, but third grade, you gotta, you know, I don't want to lose it.
I'm not going to disagree with that, but I would push back on losing high school graduation. And the reason is the disparity in income and ability without a high school degree. your odds of making a decent living are way, way, way reduced. And so if the goal area is to learn what they need to be successful, getting them all the way through high school is, I think, critical. So, I mean, I don't object to leaving math in. I agree VPK could go either way for me because that is sort of subsumed under those kindergarten readiness.
We're not in the summer bridge program.
True.
For that.
Yeah, and what I'm saying is
I don't feel compelled to lose any of them, is I guess where I'm back to.
Okay, well, I'm happy with that. What I was saying is, it's not our job to pull people over if they're speeding. That's the sheriff's job. It's not our job, in my opinion, primary job, to make sure students graduate. That's the school board's job. And so I am all for supplementing those things. But with regards to literacy and proficiency in math, I think that's also the school board's job, but we are taking responsibility for zero before they get there. And if we don't have them kindergarten ready and they know how to do certain things by the time they get to the school board, that is on us. I think it has to be on us. It's on our community. And so, I don't want to lose it either. If we can leave it in there, great. But if we're having to lose it because we got too many, then I just want to raise my hand for the math books. Y'all gonna wish I didn't show up. Y'all gonna wish I didn't.
Have too many to measure. If we keep third grade reading proficiency, third grade math proficiency in high school. That's how we came to the table. Are we okay with this, keeping it?
I'm okay with it.
Yes, ma'am.
Not to throw a monkey wrench in it, but I did hear you all somewhat agree about chronic absence.
Yeah.
We did.
We did.
So then are we adding chronic absence?
Somewhere.
It would go there. It would go here. Yeah.
So I wonder what the root cause of chronic absence, just kind of a personal, like, I wonder what the root driver of it is, kind of to board member Certain's point. However, thinking of the programs that impact it, we do have our wellness coordinators at the community, at 3 school locations that have the absence issues. It is one of the things that is a focus for them, is to help reduce the chronic absence in those 3 particular. Other programs that we fund also research. After school programs. We don't measure that, but we certainly could measure that in those type of programs. I think other things like transportation and health and definite root cause.
Question, can you graduate if you're absent? So why?
Yes, you can.
I know from my
Yeah, you
day,
can.
there's a certain number of days,
Yeah.
even if you have the grades, they don't let you.
Well, they just like, we're kind of like, the state and everybody's kind of like now focusing back in on truancy, and districts are now starting to do truancy, enforcement. But for 5 or 6 years, yeah, really, from COVID up until this year, this is the first year, I mean, districts that have started, even here, Judge Bullitt.
Yeah, I mean, again, I love high school graduation, but if we had to choose, I'd put student absence before that.
I would prefer to leave the high school graduation in, Ken, and only because of a lot of the programs that we're funding that are doing good work. That is, absenteeism is one of their metrics that they're trying to make sure that students are in school every day, behaving. They got a lot of that. But the high school graduation, to whoever said, is an income driver. It is like a gateway. You can't do the military. We can't do Santa Fe, can't do anything. So we really want that in there. We know we have an economic disparity in our community with earnings. We want to make sure that we're funding things at this point where we're getting kids and we're kind of at least launching them into adulthood.
So I know we don't want to have too many measures. I understand that.
Let's keep high school graduation.
However, this is an area where we've also got, I think, the majority of our money. So from my perspective, I would keep them. We've got other areas where we only have a couple, 3 measures. If we're going to overload an area, why not be in the area that we're most broadly and significantly funded? And keep them all.
Add it and keep it.
And stop arguing about which one is more important.
So then we are adding chronic absence.
I think we leave whatever.
Oh, one of them.
VPK, I'm okay if we leave, but
Oh, so you're saying so third grade reading, kindergarten readiness, high school
and if
graduation.
you want to drop VPK, because really, although somebody said we'd do summer bridge, so.
Okay, now, we hadn't had a conversation about quality childcare enrollment, but you say add it in there or no?
Oh, are we funding that?
We're still funding VLI.
VLI, that's what I was getting.
BLI,
Let's
the,
leave it all. in.
what is it, childcare, CTA, tuition,
Yeah. So
Okay.
is it having an impact?
Yes.
Okay, then we need to know that.
Yes.
Okay.
Whoever just said, stop arguing about it.
Meg.
I'm with you, because I'm fading fast.
Board Member Hart.
Yes, Board Member Hart, and then.
This is just a footnote on chronic absence. It's almost like two different creatures. When the kids are too small to get to school, it's a parent issue. When the kids are big enough that they can either go to school or go somewhere else, it's a different issue. So I can tell you that with the little kids, it's got a lot to do with, what's going on with the parent? Do they even have an address? Do they even know what school to take the kid to? There's housing issues, there's a lot of economic issues. And then by the time third grade happens and humiliation begins in school, kids don't want to go to school anymore. But I think before third grade, kids are all in if they can get there.
Hey, so it sounds like we've talked ourselves into including
All of them.
the community level indicators for this area for various solid arguments. Anything else on this? And then, oh, I'm so sorry, staff. Yes, Bonnie.
So we talked about you guys want a baseline or where you want the goal to be. So this full of one of them I have on screen now. So this is the history, the blue line is the history of Alachua County from 2010 and beyond.
It's adequate.
Yeah, do we want to set a goal for where we want this to be? Oh, as well as all the other, and what's the,
Yes.
you want us?
Once you know what you're doing and what your providers are doing, you can decide how do you move this for the kids that participate in what we fund, because you're not, you got to show a difference between the kids that are in our programs versus the general.
I think that was Director Labarda's first statement, that we have to set the goals where we want to go on each one.
So what I heard you say before was that we want to look at the baseline for each of these community indicators. We want to look at where it is now, and then we want to set a goal for where we want it to be at the end of, like, in 3 years. 2030. So right now in Alachua County, VPK enrollment is at 56.7%. Do you want to go through every single one of these community indicators and say, in 2030, we want to be at 66% or whatever?
You can only really do that if you have some basis for assessing. And it may be that you look at initially, okay, how many people do we have participating in our programs that address this? And how far have we moved the needle over the course of a year? And start to figure out, you have to have some rationale for the target you set. But the notion here is that we got to have some measurable impact, at the very least, on the kids that participate in the programs we fund. But yeah, ultimately, we have to decide what that target is. And maybe you can look at other CSCs that have funded programs in this area and what kind of input they've had for their area to begin to see what's possible. Setting targets is a art in and of itself, so it's going to take some additional digging, but at the very least, we should have a sense of what the programs we're funding are able to do for those kids that are involved.
Right. So for VPK enrollment, I think through the child care scholarship, we fund 65 kids, I think, in VPK. And I think that's the main program that we're funding that addresses VPK enrollment. So if we were going to go, if we were going to set a baseline, you know, we could look at the number of children that we're providing scholarships to this year. Maybe we want to increase that next year. And, you know, how, you know, or maybe we want to have a marketing campaign where we, you know, get kids to VPK. But here's the thing though, if we decide we want to have some, you know, we want to find a marketing campaign to get kids to go to VPK, we have to think about what is their capacity, how many kids, you know, are they trying to get to VPK? So then we're going to look at that program, set their target, based on
them to set their target.
no, of course, yes, work with them to set the target. And then we're gonna look at whether or not they meet the target. But, you know, I can't set the target right now, obviously, because I don't know what it is.
Yeah.
But if,
We're not asking you to have a number by tomorrow. But what
Right.
we're saying is if we want this to effectively let us know how we're doing, at some point, we got to commit to a number and figure out what that is. And maybe you spend a year researching what that ultimate number by 2030 is going to be. But for right now, we know, at least let us know what the baseline is.
okay,
At the very least, we need to know what the baseline
Like right
is.
now, we know 56.7%.
that's the base
And-
The baseline, that's the baseline.
Yeah,
Yeah,
for this one.
yeah.
But I think what we're saying is, I'm sorry, when we look at the impact performance, we're saying we want 80% of the programs in that focus area to meet their targets. So the targets are going to be different.
you don't like that.
I don't like
Like
that.
it,
To me,
but
that's not a
it's-
meaningful way of looking at us. I mean, you know, it just is, what are we trying to accomplish? What we're trying to accomplish is moving a number on those kinds of
Right.
metrics.
And so if we worked with like a marketing campaign and we said, your target is to, you know, we want 300 additional kids enrolled in VPK, then that would be their target. And if they meet the target, then we are on the road to doing this, to moving this number. If our programs meet their targets, the targets are vehicles to get us to these numbers. I hear what you're saying, but I'm just trying to figure out how we're going to do it. And I'd love to, you know, hear.
That's another workshop that we have. Work instead of us kind of bogging down our strategic planning. If we need to, the board and staff, we work with our areas of expertise, we work to get granular like that. Maybe we have a different workshop for that. I don't think today is the day
Yeah.
but I do think I think.
I think everybody's understanding what the other is saying. I think at first we weren't, but I think everybody's understanding. It's just how we get there. So I like your suggestion, Tina. We can come back, we can go back to the, you know, sit down, kind of look at what you all had already stated, and then come up with the numbers, and you already have some of the baselines.
Yeah.
So you have the numbers.
And maybe
Yeah.
the staff may not, because we, like Dr. Hart and Dr. Labarda, different ones may have expertise in certain areas and be able to provide input to them. So that'll keep us moving along and we don't get.
And just looking at this, I'm really glad you brought this, Bonnie, because look what happened. From 2017 to 2019, we exceeded the state in VPK enrollment. Then we went south and we've never inched back. So, yeah, but COVID's over and we're still not getting anywhere. So, you know, it almost begs the question. We've put a lot of our effort into getting those early learning coalition scholarships, and we're missing something. I don't know what we're missing, but why would we be below the state? So a simple goal would be, we always want to be at least as good as the state. Come on. We're Alachua County and we have a trust, right? At least as good as the state.
That's true.
And if we can't do it, we got to figure out what's missing. Something is missing. And maybe if we were to invest in a media campaign, they would figure it out. Same.
I think we're there now. I'm feeling much better. I'm feeling better. This is good. If we go now, and I just want to make sure, because we've been talking about the community level indicator alignment, but we haven't spent the time on the strategies and the performance measures. I want to make sure, because we've got We've got about an hour and 15 minutes. So do we want to go to the third goal and just make sure the indicators are right and the same to the fourth, and then go back and look at the other items? I just want to do this in the way that you all want to do this.
That makes sense.
that sounds good.
We have a guest. Could you please introduce yourself? Do we?
Yes, good. Can you hear me? Do I need to stand here?
Yes, please.
Oh, no.
Good afternoon. My name is Connie Pierre-Antoine. I am the CEO and founder of Genesis Family Enrichment Center. Number one, I'd like to say thank you to the Children's Trust and one of the providers that provides trauma-informed education and workshops to other providers that the Trust supports. And that is near and dear to my heart. I will just say two things. What I've heard today was there are a lot of programs that the Trust is supporting that is geared and focused towards youth 0 to 5, right? There's a beautiful understanding of what happens to children between that age and stage. And that readiness and preparedness gets them successful outcomes as they move further, right? 6 and beyond. I also heard someone say, what are we missing then? And as a mental health therapist and as an organization that focuses on parents, I would like to enforce or reinforce the idea of looking at parents. The way that the brain develops, learning, whether it be reading and writing, will not be successful with all our community drive if parents and caregivers do not understand their important role between 0 and 5. And so there are lots of fruits that is being produced by this wonderful trust. We still haven't gotten to the root. And what I know and what the evidence suggests is that there is a lot of attachment needs that are unmet in our community as well as others, that parents and caregivers must meet and recognize those needs. And it's the foundational part of relational learning, academic learning, social and emotional learning, getting kids to school, right? That all starts from what happens within the home. And I just want to stress that. And thank you for your time.
Thank you for being here. Hour and 15 minutes. Don't let me lose control. Fire me.
You're asking what?
So I think what Conchita had asked, do you want to go back to the safe spaces goal? O3, and look at the strategies in that area and talk a little bit about those.
Strategies. So I think
No,
we
you
are
have said
live.
some things about it, like youth arrested and adding civil citation.
So we are good with just those two? Just want to make sure that when we look at community and youth live in a safe community, we are good with school safety incidents and youth arrested and the other civil
Citation.
civil citation and we're good? Bonnie, also, you guys too?
With civil citations.
I
That
think
we
we had said with civil citation, we'd ask Judge Bullard if that was still a viable measure of anything.
Is there
Bonnie and
anything-
Amy, do you all have any comment on that?
Well, we pulled up the data. There was, I think, 122. So the question is it a good thing or a bad thing? So it's an alternative for arrest.
Alternative.
Yeah, it was designed to,
Yeah.
To look at that.
It was designed to reduce the number of youth arrests because the negative impacts of youth arrests on the youth were significant. Citation offered an alternative and a different sanction process.
And there should be lots of data on that, I would think.
So Jackie, do we go on to goal 4?
Let's look at prevention, the prevention focus area. There you had the community indicators were school safety incidents and youth arrested. And then we talked about the disciplinary thing else under the prevention arm.
So I'm still looking at this civil citation thing. I'm agreeing with my colleague Amy here. Do we have any control over whether law enforcement decides whether or not to do a civil citation? But the programming would hopefully prevent the arrest, which would make them law enforcement eligible to determine what route they decide to.
I think we want to lower the number of both.
Yeah.
Lower.
Yes, I want both to go down.
It's not a continuum because I don't think we could. That
Arrested or issued civil.
It basically is a notice to appear. The child ends up having to go before the judge, or I don't remember. I mean, it's been a little while. But it's not, they don't get taken, yeah, they don't get taken to the detention center.
Okay. All right, let's go to goal 4. There are no community indicators for goal 4 because this is a new one. There are strategies there and performance measures. If you take a look at those and give your correction on those.
To set this up. At our last board meeting, Nancy, if you will remember, you were very passionate about, again, meta programming. And we kept saying we were doing some meta programming, but we felt that maybe we were not, doing exactly what you all would like for us to be doing. And we wanted to ensure that you understood what we have been doing. So Belita is going to just take, a few minutes to share with you all what we have been considering meta to date. And then we'd like your feedback on what you would like to see us doing moving forward. Okay.
Thank you, Edie Kiner. I will provide a brief update on CTAC's progress with meta training and highlights on how training has been implemented. The meta training that CTAC has structured approach to strengthening professional development, ensuring staff are equipped with practical and trauma-informed tools to support children, families, and communities. This update focuses on our progress made, training access, and how providers are engaging with available learning opportunities. We have added as a requirement for our providers to complete a minimum of 20 total training hours during the contract term. These requirements ensure that CTAC meet the board requested training while assisting providers in building capacity in critical service areas. Next slide, please. CTAC offers a robust catalog of trauma-informed and specialized training to support provider professional development. Just to give you a description of some of them, we have a trust-based relational intervention 3D workshop, which is an attachment-based trauma-informed model focused on empowering, connecting, and correcting principles to address the needs of vulnerable children. In addition, there are these are listed, I won't call them back out, but which explore fear responses and relational safety. It examines behavioral patterns through a developmental lens, as well as focuses on stress response system, which reframes psychological development through neurotypical and neurodiverse perspectives. Also, these trainings expand trauma responses beyond fight, flight, or freeze. In addition, we offer advanced human trafficking training, a three-hour course scenario-based designed for high-risk populations. This training covers trafficking types, risk factors, provider roles, multidisciplinary interventions, and includes components of compassion fatigue, as well as trauma. Lastly, we wanted to point out our most recent training in the last fiscal year. CTAC offer a wide range of professional development opportunities, including as listed human trafficking, trauma-informed care, restorative justice, deaf, blindness, education, suicide prevention, CPR, working with children with special needs, and mandatory reporting. These trainings were delivered through a mix of in-person, virtual, and on-demand to increase accessibility for providers. As a result, 98% of the providers successfully met their training requirements, demonstrating strong engagement and system-wide compliance with the meta training expectations. And just to share a little bit of the responses, this is direct feedback from providers who participated in the CTAC supported trainings. These responses capture how providers experience the trainings and the perceived impact of their knowledge, confidence, and day-to-day practice. Collectively, the feedback demonstrates the meta training is not only increasing awareness of trauma-informed approaches, but also influencing how providers engage families, manage complex behaviors, and apply new strategies within their programs. These insights help us to understand what is working well and where future training efforts can be strengthened. So this is our update on where we are in our meta training structure and implementation, and we'd love to hear from you how we can improve it moving forward.
Very helpful. Member Cornell.
Yeah, I think this is a great start. When I think about this area, two things come to mind. One, where I guess we're getting to later this afternoon, making sure that all our providers are going through this nonprofit life cycle and identifying where they are. And really the self-evaluation of where they are so that we can support them based on where they are. And that to me goes back to this idea that we can't be funding 100% nonprofits. Certainly maybe startups, we can provide them with a lot of funding, but that we need them to be sustainable and leverage CTAC dollars, not rely solely on CTAC dollars. Point one. Point two, I guess, would be that when best practices are identified, that we have set up systems and process to systemically implement those within the CTAC provider network, whatever that is. Whether that's financial reporting, whether that's client service, whether that's something related to literacy, that when we see a best practice, it could even be a best practice somewhere else in the state, that we implement that throughout the network of providers. Thank you, Madam Chair.
We'd love to hear from you. I always have something, and I want to say this is amazing. I had no idea that you were doing all of these things. And if I'm understanding this right, the meta programming that we have now is aimed at the providers and the staff within each of our programs, right? So I'm amazed that we did this much, because what I was thinking was it would be a lot to ask a provider to develop a skill in training children or training staff in these specific things. Because, for example, human trafficking is a really specific weirdo thing that has different age perspectives, and it's tricky. And I thought, and maybe you did exactly this, you got the expert come to do the training for all of our providers, like covering it in a meta sense. And I guess I want to make sure that you've thought about are there any other meta training opportunities that could happen from the expert in the community directly to the children participating in the program? And for example, in the mental health area, and Maggie, fix whatever I say if it's really stupid, but it's really not a bad idea to train children what warning signs for suicidality or depression to look for in other children. And then tell them how to report that back up to their teachers or the staff in the program. And just want to make sure that that level of training can also happen, perhaps in a meta way, having the expert come in and do it with the kids. Love that.
There are evidence-based, particularly at the high school level, youth mental health is set up to train kids to be peer.
That's what I was gonna say, peer.
PALS does their own peer. I'm not aware of any specific ones for younger kids in that area, but that all fits into that whole social emotional development and support category. But yeah, that would certainly be something that can be done, and it's typically the mental health first aid classes are done in they can be done in segments, that can be done online. There's a whole bunch of different ways to do those.
I was thinking as you were talking, that is also, we have enrichment providers. So we can also have a provider to go in as an enrichment provider to be able to do that with the kids.
But just as a point of clarity, page with required training, the providers have a choice of what's relevant for them.
They, well, yes, up to 20 hours, but they have to take the 1 through 4. They have to take the required trainings, which is the trauma, the 1 through 4 that are listed on the second slide. Yes. Mhm.
I love that.
Good job.
Any other questions from Mia before we get back to our?
Thank you all for that.
I believe it, I'm sorry.
Yeah, thank you for that clarity.
Everybody else, I was like, wait.
I just said.
Welcome.
So, so now that you have had the meta training presentation, if you would take a look at area 4, focus area 4. What's your thoughts there?
Okay, so I don't want to throw a wrench in this, but we are about to go into profit life cycle from the trust perspective. And next time, I promise, I'll call my fellow board members if they don't. Time if you give me 24 hours. I think this is important input, but trying to build the capacity of the trust as well as the capacity of
The
providers.
providers?
I've been a part of processes in an organization where we had a goal or an area under a goal that included internal, not just outward for the providers. So my question is, could area 4 be tweaked to include this capacity building A for providers and a B trust? System building for the trust.
Love it.
Love it. And that's as important to measure and to do to meet the providers in their growth.
Like that. Tura, could you pull up the the performance measures on this one?
And I guess my, Ms. Regina, and Mary, maybe since we all the trusts did not do the selfie, maybe we open that. I said all of us didn't. Said all of us didn't do, all of us didn't, but the numbers show that. So would it be possible we just open it up and those who did not complete it, we can do it afterwards? I mean. I'm not.
Tracy is not here yet, but I think we can ask that question.
Yeah.
Madam Chair, I very much like adding a B and talking about internal capacity.
Anything else on the, Maggie, you've been most intimately involved with CNE and all of this.
A lot of these performance strategies get aligned. I was looking back. My thinking is we've got strategies with no community level indicator in some of these goal areas. And so then you have program performance measures. I think that it ought to, that every strategy ought to reflect the community strategy, and then you can start. So for this one, it just seemed to me, that's a lot of them. My strategy, that might make it not look, oh, sorry, that might make it look here. Not quite so, so onerous. The thing that's not here, and I can't remember, do we require people to be certified in the hub before they can contract if they're a nonprofit? We do, right? So that's one of the requirements. Okay. So then that wouldn't, we don't need to do that because we wouldn't be looking at them. They wouldn't qualify if they weren't in the hub. So yeah, I think, I think there's a lot of performance measures that maybe we can be condensed and consolidated rather than having quite so many. So thinking about the promoting the training opportunities and then facilitating engagement, what do those look like under that? And you might be able to you could combine. Yeah, satisfaction or, that you can say that the trainings, the providers report that the training has enhanced their skill set, or they kind of make it so that there's fewer.
And I just wanted to be clear, we do have them go to the philanthropy hub, but that is for the 501c3s. Yeah, okay. Oh.
I realize you can't do that with the for-profits.
I wondered about done workshops at the end of grant cycles to share the outcomes and what everybody accomplished and learned. And I'm remembering most vividly, I think it was after school providers and them sharing how much they learned from that. And also to look at, well, what did others achieve? So, and then I also heard providers talk about the value of collaborating with other providers. And as we think about what's could be duplicative or turf guarding and trying to discourage that kind of behavior to add as we're trying to reduce, but I don't really see any conversation about that. Learning from the end of each cycle, not just what they did, but what happened in the community at large, and encouraging a culture of collaboration.
So as a strategy, sharing best practices, the encouraging
Strategy of collaboration, yes.
collaboration,
I
and
think
then,
that is a strategy.
yeah, we can do that.
The convenings.
I was just thinking that we have convenings and where they're allowed to, yes, we have
I
convenings.
just think we should talk about it
further.
and measure it and state it as a strategy, because
Okay. Anything else on 4?
I want to address if we're going to have a 4B. That's really a lot of leadership and staff, but
It's the system building.
The system building, the things that maturity wise, when I took a peek at the selfie and we're growth and maturity, a lot of that standard operating procedures.
come back to you with, you may hear some of it this afternoon in the second session. And then you can say, let's add that to, into focus area B for the system.
And might we start that with an objective like CTAC is equipped for continuous improvement, or, that kind of thing? And then the things you all do this afternoon, what are the 3 to 5 things that we will do? So on A, providers are equipped to be successful. Knowing that CTAC already is, we just say for continuous,
And would we change goal 4 to empower and equip CTAC and our provider? Or
Yes.
one or the other, provider community and CTAC?
Yes. We would leave it as one, and it would be what you just said, CTAC and, or our providers and CTAC. And then we would start with A, the way that it is, with the objective for the first to be providers are equipped to be successful, and then B being the objective is CTAC is equipped for continuous, we can figure the words, but continuous improvement.
Improvement.
I like, related to the selfie and the nonprofit life cycles, there's a strategic planning book that I really like, and the guy talks about the focus should always be on relevance, impact, and sustainability. And so is that the CTAC, the objective could be around engages in activities to enhance or maintain its relevance, impact, and sustainability.
We did.
Relevance.
Well, it is super important because 3 years will go by and whoever, these chairs may not be talking about this book, et cetera.
But if we're still talking about maintaining our relevance, impact, and sustainability, then you're there.
Okay. I think we all have our marching orders, both staff and C. Robinson Associates. So, Marcia, you want to talk about next steps, or? I think that has changed now.
Well, first of all, let me say thank you to everybody. Everybody from staff who you all have done a yeoman's job in answering every single call, every single time we've said we want to survey you, we want your opinion. Last week, whenever it was, please, please, please do the selfie. So thank y'all. Thank you, thank you, thank you. C. Robinson and Associates, you all just continue to rock. Even when we come to you and say, hey, we want to make some changes and we're turning everything upside down, you all just went with it. Thank you for your patience with us. It has been truly a pleasure working with you. Thank you, thank you, thank you. I have to say something to Bonnie and to Amy because they did a heavy lift in helping come up with the community indicators, doing the research, the performance, the system, everything. So thank you guys for all of your hard work. And then finally to this board, as usual, we know that when we come to you all with whatever it is that we're bringing, the fact that you all are such experts in so many different areas, you help us to ensure that we are getting it right. So thank you, thank you, thank you for heeding the numerous emails. And we know holidays are hard, right? So thank you, everybody that took the time to complete those surveys. Next steps. The plan is for us to take what we've heard today, go back, clean it up, and bring it back to you at our February 9th meeting. Hopefully, that will be our last, reading of it, and you all will be willing to adopt it at that time, adopt and approve.
We would like to then come back to you at our March 9th date, right? Somebody help me with the dates. March 9th. We would like to have a workshop to talk about how we fund programs. We didn't feel that we could have the discussion about funding mixed in with the discussion about what the plan needed to look like. It was just too much and it was going to be too cumbersome. So we would like to come back to you at the March 9th date with a workshop to have a discussion about the funding allocations for priorities and providers. Oh, okay. March 9th for a workshop. Say again. The February date isn't on the calendar? Okay, did you just decide you were done with us or what? You're no longer chair and you just.
Correct, that's.
No, I'm going to send something out, but I wanted to let you know that we would like to hold a workshop before the March 9th regular board meeting.
The county and the city of Gainesville have a joint meeting that day,
Ooh. Okay, we cannot do it that day.
1 to 4.
Okay, so why don't, no, it would be before, it would be before that. So how about this? We will send something out to gauge the majorities. Will you be here that week? Okay, so I'm thinking, right now I'm thinking Wednesday. What's the date Wednesday, the 11th? Are you here, Nancy? I won't be here? Oh.
Is earlier on the day on the 9th a possibility and take a break?
What time is your meeting?
It's from 1 to 4.
So you could do it that morning? Are the rest of you available Monday morning? So 10, 9? We can do 9. Can everybody do 9? 9 to like 11? And I don't know that we'll need that whole time. All right, then let's set it 9 to 11 on the 9th. Okay, thank you. Ken, add it to your calendar. Okay.
But we gotta, I mean, use it, yeah.
Executive Director Kiner, may we take a bio break before
Yes.
the,
Oh, may I do one thing before the bio break? We have a new staff person that is in the room and I did not, please forgive me. We got started and I did not introduce her. We finally have a director of communications. So Darlena has joined us. This is week 3. We are so happy to have her. Darlena, come to the mic and just tell them a little bit about yourself, if you don't mind.
Hello, it's so nice to meet all of you. It was so nice to see you. And I was really, really pleased to be able to deliver that annual report to you at 11:59 a.m. That's how I roll, right before the deadline, but always on time. I come from journalism background, worked in television news for a long time. They poached me from CBS 4, in fact, where I was the creative services director for many years. I work at UF, teach at the J School. I watch school board meetings all the time, all 17 hours of them. Because there's always somebody saying something very interesting, usually Tina Certain. No, I'm just very happy to be here. The trust is wonderful. I'm so excited to be a part of this mission, to be a part of such planning. And I really look forward to sinking my teeth in and making you all very pretty words and very pretty pictures to go along with them. Thank you, and thank you for the welcome.
Thanks, Darlene. Bio break.
and we are resuming at
Works for me.
2:15.
Thank you. Wanted to get rid of this. You grab some more tea.
Finally, it got so bad.
You pick your state.
Oh, don't worry, I have a lot.
Oh, yes. When you're coming to my father.
Well,
Yes, ma'am.
I have a partnership. Today, want to have yeah, they have worked around it for so many years. Actually, have. Yeah.
So, it was, same deal.
All right. Is the.
I don't think they still do. I think they still do.
Something.
I agree, I agree. So. I can't speak for them. But I was answering.
Yes.
Because then there's so much touchy respect and following and accepting that we go, or did that mean it? On that.
What wrong with building a car?
It is not. And that is not their model.
But it's not.
It's not long term. They are shy of things. I think we gathered why. And we gathered why. We pushed pretty hard, actually, right? When we started, I mean,
Yes.
and they said, no, we do a warm up and that's it. If the family comes here, then we give them another warm up, but it's not a. They don't do it for anything. It's more of a.
Okay, well, I'm perplexed now. From the perspective of the classes.
Yeah.
Where we focus, because I. Said, please tell me how many. Can we get a social worker in resource centers and they don't even want it. Because they risk,
That's
you know?
basically what you said. If we could find the money, we could hire the staff. And they said.
We don't do that, it's not our model.
Yep.
We rely on our partners.
But here's the thing. Partnership is only swag and only library partnership. There are other family resource centers in our area. Probably take advantage of that. You talking about Micanopy, you're talking about the new center in High School, gonna be opening one right now. So even if leadership doesn't want to do that, we need them to help establish the other family resource centers. And then other resource centers run their own center. It doesn't mean they won't be open. That's just two partnership locations.
All right, so I need you to guide this, okay, I'm seeking this, okay, because I'm ready to go to Santa Fe and UF and say, you guys need to have a social work school. I don't care how you do it, whether it's six, whether it's streets first, whether Santa Fe does the first 4 years. I don't care. But we've suffered, you know, you put your right? It's that social.
Absolutely. I think, just keep in mind that when Stacy answers, she's only answering for those two centers. There are 4 other family resource centers.
And
I
they
think.
answer. What do they talk to, Pebbles?
The director of the family resource centers for partnership. And library partnership. The other ones I think would be open if there was funding available to hire a social worker to do longer term case management.
Right, but who's the structure above them if it's not Stacy?
It's Pebbles. It's Pebbles.
That's where the CTAC needs to go, it's Pebbles.
Yeah.
And that, now, thank you, let me know where you get.
I know Stacy and I know Pebbles a lot. I think what they're doing with family resource centers are awesome, but I think they're both gonna push back. Stacy's pushing back because that comes down from Pebbles. But let me know how that goes. But it doesn't mean we can't do it for our county. It does not mean we cannot do it for our county.
For our kids. There are other family resource centers who can do this. And if Bishop Stokes wanted a social worker, by golly, absolutely. And you know who else doesn't have to think before I say that? It doesn't mean that's where it would take us. That's where, you know what? Child center.
Got one.
So what we have to do is create an environment where social workers are a wonderful thing. Would you like that? Yeah. Absolutely. That's the reason. Yeah. So I sat there and looked at that email and thank you for wrapping your brain around it for a moment. Yeah. You know, like I'm just like. I know. I say it out loud to Marcia. I'm not surprised by this email. They do not want to do that. They are not really doing. Are they? No, that's why I couldn't understand what was coming out. Like, why are they coming back to present? I think she presented everything. However, the funding that flag is significant. I think community foundation. They had a 67,000. Yes, and they are. Piece of the puzzle. 75 families and 100 and some children. To me, that is, that's it really was eviction prevention, because maybe they're just saying, well, we gave them food support. It did prevent them from being evicted. They paid rent, they paid utilities. I don't know, and SWAG of course does have like parental resiliency and those protective factors that would help them in the long run. But once they help them, it's that, here you go, you know. You gotta follow them along. Yeah. I don't think there's a problem.
I'm sorry, I did not give you a chance to introduce yourself as our new representative of the Department of Children and Families. So thank you so much for being here. Can you tell us a little bit about yourself? To push your, we didn't train her either.
Okay, so Melissa Walker, I'm from the Department of Children and Families. I have 25 years there. Cheryl Twombly, of course, was my coworker, I'll say. So worked with her for a long, long time in different capacities, but some of my history involves contracts and program management.
For that contracts and.
Well, you just push it to talk, just and maybe
Oh,
hold it towards you a little bit.
okay, better. Okay, so yes, almost 14 years of contracts.
How long have you been in Alachua County?
I actually don't live in Alachua County. I worked in Alachua County. But now I am mainly in Lake City. My area of coverage expands from the Panhandle all the way over to Yulee, so I'm the whole top of the state. So I'm all over the place. So
Delighted to have you with us. Thank you so much. Tracy, are we putting you on the spot to start early?
Help her. Someone help her.
So without further ado, I want to introduce you to my colleague of 12 plus years and ongoing friend, Tracy Berger, and working with us and working with providers on nonprofit life cycles. Tracy?
Thanks, Mary. I have just a little bit more background. I've worked with Mary for 14 years at the consortium. I'm still there. Worked in the nonprofit sector for 25 years. It's just kind of a passion of mine to help build capacity of nonprofits and help them do what they're supposed to do, what they really want to do, and meet their mission and be impactful. The work I've done at the consortium is member development or nonprofit foundations around the state, support them in growing and developing, being strong and sustainable so that they can actually do what they're supposed to do in their local communities for their teachers, schools, and students. And the consortium has a state matching grant that really provided the impetus for us to help develop some of those ed foundations, kind of like the trust. You have funds for these providers that you need them and want them to be successful at. So that's kind of where we came from. I'm board source certified, and during my certification, I learned of this life cycles, nonprofit life cycles thing. And about the same time, the consortium was going through some really great growth, and a facilitator walked us through this process of understanding, gee, you're not perfect. You're a mature organization pushing yourself into growth. And so it's okay. You're supposed to. And that was a really big aha for me in helping to understand how an organization can grow in their capacity, how the consortium and the trust can help organizations build their capacity, and how much actually they kind of need it. So thank you for taking time today. Thank you for having me. I know that, I'm making space for this conversation, and you're very busy and almost done, I understand, strategic planning process. So appreciate that. And I have a PowerPoint. Did we have that up? Thanks. Okay. So, so today's discussion is meant to support your strategic plan that you've been working on, not compete with it or override it or start over. Okay, so it's really supposed to support what you're doing, what you're thinking about, what you're talking about. So we're using the nonprofit lifecycle framework to do two things here. One, help you all understand where the trust is right now as an organization and what kinds of capacity will be most important as you move forward from growth to maturity. So what are your capacity needs as an organization? But also use that same lens to better understand why many of the organizations you fund struggle with deliverables. Even when their programs are strong and aligned, they seem like really great organizations. but that they can be also, they can have strong programs and be aligned with your priorities, but also have struggled with some of those deliverables. So wanting to understand those two things about where this nonprofit life cycles stage framework lives or can help and support you. And I want to just say up front that nonprofit life cycle work is descriptive. It's not judgmental. It's not a rating. It's not a competition. It's an understanding of where you live, an organization lives in the stage, and what capacities they need to build and strengthen so that they can grow and meet their mission better. So the goal, again, isn't to label the trust or any of the providers, but to make smarter decisions about expectations, support, and pacing, okay? So I just would like to go do a little round robin here with the board. One word you associate right now with the CTAC's current moment, one word. What is it? Developing? Developing.
Impactful.
Impactful. Thriving, okay.
Promising.
Else? It's a round robin. What was it? Learning.
I'll say serving.
Serving. Okay, well, you're on the board, kind of, sort, aren't you? Okay. Okay, love that. Awesome, great, thank you. So next slide. So I just wanted to, I know you know your mission and vision, right? You could recite it in your sleep, right? I just wanted to ground us in that as well, because you support a coordinated system of community services. Support a coordinated system of community services that allows all youth and their families to thrive. And you envision that every child reaches their maximum potential. So you notice that the mission doesn't say we fund programs. It doesn't say that. It says we support a coordinated system of community services for the end. So I just wanted to emphasize that, and I'll probably come back to that a couple times. So the nonprofit life cycles overview. The framework is based on a simple but really powerful idea that organizations evolve through predictable stages, and each stage requires different leadership, systems, and strategies, right? You can't be an incorporated organization and all of a sudden have a full board, a full staff, and tons of money to work with. Sometimes maybe we think that, see a viable nonprofit organization and you think they have it all together. Well, we don't. One of the biggest challenges for successful organizations, especially funders, is that program growth almost always outpaces infrastructure. So when you're a startup organization, they got incorporated, they're so excited about building programs, they just want to do, right? That's why they started. That's why they formed their organization. They want to do, so they start programs, because I think that's what they're supposed to do. But that growth comes with some needs for some infrastructure, some funding, some administrative systems, some leadership and staffing capacities that don't always think of that, right? We just look at the programs and what they're looking like. So I want to review quickly. I know that you've had this before about what the nonprofit lifecycle framework is. I just want to review it. And I know you have all read this book last night and memorized it. And, but to put us all on the same page, I want to review it to ground us right now in this moment. So we can start those slides, please. So what is capacity? I always used to think capacity was money and staff. It's not. It's the full organization's capability and competence, their ability to perform and be effective, which encompasses a lot of stuff, a lot of different things, not just money, not just people and staff. So in this analogy, this is the nonprofit life cycles kind of framework. They have an analogy of a mission is like a vase on your table, okay? And what's your mission? For a coordinated system of community services that allow all youth and their families to thrive. That's your vase. That's what you're looking for. That's what the table is for, right? That's the only thing you really want to look at is that vase and what's happening in that space for allowing all youth and their families to thrive. Your programs support that mission But what supports your programs are your table legs of management, leadership, and staff, excuse me, governance and board, your business model, fundraising and revenue, and your administrative systems. So just like you sit at a restaurant and you sit down and you put your elbow on the table and the table goes rocks on your waters everywhere, how frustrating is that? What are you looking at when that happens? Everybody's looking at the table legs, trying to put a matchstick, or there's no matchsticks anymore, put something under the table to level it. So you're not looking at the mission, you're not looking at the food, you're not looking across the table at the person you're sitting with. Thank you. Okay, thank you. So that's the analogy. The table legs have to be strong to support what's on the table, right? Your mission, your dinner, if you will, right? So that's the analogy we're going to talk about. And so next slide, personal life cycle descriptors. So life cycle stages is kind of like a personal life cycle. Terrible twos, the teens, midlife, baby boomers. We wouldn't expect a toddler to be able to make their sandwich, right? Maybe a teenager, we wouldn't expect a teenager to, give us a financial plan for their future. You wouldn't, maybe depending on the parent, okay. But you see what I'm saying? And we're okay with toddlers not being able to make their sandwich. Why would we expect them to? They're not developmentally ready, all right? Midlife comes and maybe it's retirement or thinking about what you're doing in the future. You have two options, right? You can either sit at home and watch TV for the rest of your life, or you can do something different and new and build your life. So the same kinds of framework or examples are aligned with nonprofit organizations, okay? It's different expectations at different stages of the life cycle. Next page. So the benefits of nonprofit life cycle thinking, shared vocabulary. We're getting everybody on the same page, like we're doing that today. That this is descriptive, it's not judgmental. Different stages require different capacities builders. You're normal and not alone. That's what the consortium realized. I think that, oh, this is a normal phase that we push ourselves into growth and it's hard, right? It's hard and we're not perfect. It's clear communication. You can communicate where you are and what you need. I was working with a small nonprofit foundation, DeSoto County. Their new executive director, I worked on this with the head of strategic planning session, and we did this nonprofit life cycles work. And they had a big funder come and say, hey, what do you need? What do you need? Out of the blue, right? Wanted to develop the organization. How often does that happen? They knew what they needed because they understood where they were in the life cycle. They didn't need program funding, which is what you think. Oh, I need more money for this program. They needed staff to be able to build their programs. So that was the beauty of the working through the life cycles, nonprofit life cycles. They understood what they needed. They were open to receiving it and get it, not just go to the program piece. And again, like I said before, it's depersonalizes it. It's not personal. It's really it's the stage in the way nonprofits work. It's a steady stage in systems. It's not personal. It's not anybody's fault. It's not staff's fault, right? It's not the board's fault. This is where we are. So understanding how we can strengthen in these areas. So the next slide shows kind of a graph of this actual framework, 7 stages of nonprofits. I'm going to go through those really quick, but again, each stage has tasks, challenges, and growing pains. Life cycle stages is not age or size dependent, right? You could be a 30-year startup. Have you heard of that term before? Yeah, it doesn't matter. I have a few of those I work with at the consortium. So a maturity is kind of the operational or, the optimal operational stage, but also mature organizations need to maintain their competitive edge. They need to keep growing. They need to keep looking outward at what their community needs in order to keep growing. Otherwise, they face a risk of decline, and turnaround or terminal. So the really sweet spot, and on this graph is vitality, that sweet spot between maturity and growth, keeping yourself, pushing yourself a little bit. And I'll just say with, so some of the stages, the growing pains can be stalling points. For example, I know of an organization who's been around a long time, does great programs, great programs. They've been in the growth stage, which is a long stage for a long time. Their executive director is really a program person. It's a program, so they have great programs, but they can't really go to the next stage of, multi-year funding or being really known in the community, doing some really great things until they really understand they need a true executive director. So that's stalling them at this stage. So let's go through the stages really quick. Idea stage is really, it's before, it's an idea. A couple people have an idea to meet this need in the community. It's really the magnificent obsession, no formal organization, but it's really just the mandate to fill a gap or need. And the questions really here are, what is the need? Where is the gap? Who else is in this space? Kind of important question. Startup is, I think we can go. Startup is labor of love. So this is where you are incorporated. You got unbridled mission, energy, and passion, but generally without corresponding governance, management, or resources. Again, you're building programs. You want to do good in the community. That's why you get started. The founder is generally personable, charismatic, and inspirational, but may not be a great manager. Okay, so it's easily forgiven at this stage, but not so much when you get into growth. And volunteers are really the first staff. So then in growth stage, this is kind of the adolescent stage. It's a long stage. It's becoming where you are. You're starting to get known in the community for your mission and good programs, but service demands exceed current structural and resource capabilities all the time. There's not enough staff. There's not enough money to do what you want to do the good work that you're doing. Maybe. So it's really also a time to test your wings, the nonprofit's wings, and what you do best. What is your distinctive competence? And you need, in this stage, you need to become less dependent on individuals and be more system thinking or method or oriented. So if you've got, here's where some growing organizations get stuck, is they keep staff, same staff, and the staff isn't growing with the organization. They don't have the right skills, et cetera. And the executive director doesn't want to fire them, doesn't want to make a change or move people around, that kind of thing. Also, the sticking point here is the board doesn't get their act together. This is a big growth area for boards as well. So the board has to grow up in this stage, really get their governance systems in place. So then mature, it's really kind of, you want to think it's the ideal stage maybe, but it's really you're well-established, you're operating smoothly, the community knows you have a great reputation in the community for providing consistent, relevant, and high-quality services. Everybody knows you. You're actually sought out for public policy kind of things, et cetera. Your boards are policy-driven, well-functioning, they govern in themselves. And leaders here must be really good motivators and anticipate both internal and external crises and be able to thwart those. Must maintain the community's confidence here. So you can see that executive director role is a little different here in this stage. This mature organizations have ongoing sources of funding, but they also, again, need to look for new opportunities to enhance their existing services and fill market voids. They can't just sit there. They have to push themselves into growth. And then decline. This is when services are no longer relevant. The organization is self-indulgent. They think only of what their needs. They're not looking outward to their community about how they can fill community needs. They make status quo decisions. They really don't starting to have insufficient operating income to cover expenses. It's kind of like the midlife crisis I was talking about. You can either go into the sunset and watching TV, or you can change and grow, and that takes some really strong leadership to do that. The last one is turnaround. So that's really where the rubber meets the road. If you've started to decline, it's really getting some new blood in there, leadership to really make decisive actions, build the community support again, et cetera. And then terminal, that's where the organization really doesn't have any purpose anymore, no energy to continue. And sometimes this is kind of planned out for an organization who has decided this is their mission and it's done at this point. So it's not always bad. So those are the stages in this model of nonprofits. So most organizations, like I said, are somewhere in the growth phase. We often see, strong mission clarity. They know what they're doing, expanded scope and expectations. They're doing a lot of different things. They're increased public visibility. But there's also a real strain on staff, systems, and communication. You're growing, growing, growing. Those aren't caught up with your programs. But that's not dysfunction. I want to be clear, it's not dysfunction, it's a development. It's a developmental stage. And it's, yay, we're in growth, right? It's not, we're struggling. It's like, we have a growth, it's an opportunity. We're just here on the life cycle. So did you all get the handout for your trust selfie results? Okay, we're gonna go through those really quick. So 21 of you completed the survey, mostly staff. I just want to note that you had some board participation. Well, I'm happy that you can, I can run this again for you, but for today, it's just knowing that it's, not included here. Yeah, that's fine. Let me know if that happens. So overall, CTAC clearly lands in the growth stage, probably high growth into maturity. You look at the graph here. The graph is what, the stages that we just showed you. The table are the individual results that you all put in. So the questions were for participants to see where the program lies, what stage, life cycle stage were programs, governance, management, business model, administration. So respondents were asked where they thought each of those were on the life cycle stage, and that's charted here. So that's how we know that you're in growth or going into maturity stage. So generally, I'll say governance is showing up as mature, strategic, policy focused, appropriately separated from operations. Programs are strong, increasingly data informed, and aligned with strategic priorities, but there's concern about spread. Management is trusted and mission aligned, but staff capacity is stretched. Business model and administrative systems are stable, but highly dependent on a single revenue stream and still catching up with operational complexity. So that's kind of in general what I get from this report. In other words, CTAC is doing what growing organizations do. You're building the plane while flying it. So I'd like for you to do in groups, in pairs, threes maybe, look at this if you haven't already. Circle things that you notice, words that you notice, comments that you notice. This is kind of a compendium of all the comments. And then ask some questions. I'm going to ask you all these questions and kind of go through these. What in these results feels most accurate? Where in the most strain right now? And what capacity gaps are starting to limit how effectively you can be? So it'll just take a few minutes for you to be able to do that and talk with your small group. Those, yeah. Well, I have this one. One. You want just need one more? No. You have it.
I'm going to give you another minute to wrap up your thoughts. One more minute. Okay, let's wrap up and share out what your thoughts were. So what in these results felt most accurate based on what you know? What of these results, what feels most accurate? Check, check, check. Funny. Yeah, yeah, you're on the same page, kind of. So is anything feel out of alignment or it's kind of like, I'm not sure about that? Nothing? Anything? Anything feel like, oh, I'm not so sure about that?
Yeah, so, Tracy, I kind of just to frame this discussion, it occurred to me that most nonprofits, their life cycle is quote perpetual, right? They have a perpetual life cycle theoretically, as long as they don't go out of business. And we are statutorily a 12-year life cycle. And much of the discussion we have at the strategic level, at the board level, at the budget level compared to last year's budget is, are we making enough of an impact so that when that time comes, which is 4 years from now, 5 years from now, the public will say, you've done so well that we want to renew.
Yeah.
And it's a challenge, right? Because it's how are we using our resources? How are we telling our story? How are we impacting Johnny and Jane's life, at age 3, so that by the time they're 7, their parents vote for this again. And I think it also drives a lot of our micromanagement decisions versus really what you nailed in the mission, this coordinated system. It's always been the mission to realize we can't do everything, but but this community has all the resources to do everything. And so how do we as an organization really lead in that regard? And I'm curious because it's like, I feel like this identified perfectly that we're in this growth trying to get to maturity. But I also feel like when we get to maturity, we want to get right back into growth because we want to be renewed and then kind of take it to the next level. And so the sentence that we spend most of our time talking about is on page 2 under the governance life cycle. Multiple comments raised concerns about emotional or optics-driven decision-making in response to provider dissatisfaction. And I'll just make my comment about this because I think we agreed that we are very provider oriented and very provider centric because we know that, well, first of all, we started by just throwing everything up against the wall, fund as many providers as possible, see which ones rise to the top, which was probably the wrong thing to do, but it's what we did.
You started, yeah.
Yep. And so what that has done though, is it's built a lot of community support. I think what we're struggling now with is, are we getting the best of the best in the areas to move the dial? So that when we go back out, we can say we moved the dial without losing, if we defund half of our providers, now we're going to lose our community support. And so that, from my perspective, what keeps me up at night is like, I know we shouldn't fund everybody because I know that these 4 are really effective. But gosh, I'm afraid if we stop funding these, we're going to lose the community support that's taken 5 or 6 or 7 years to build. And I need all of them to vote for this again. And that's what so that sentence kind of stuck out to me. And that feeling, I think many of us feel. And so if you can just fix that for us today, that would be great.
Well, so if I could, because I have the microphone, and I'm not on your board. So how are you telling the story of nonprofit success beyond their impact? Like, are you telling that? Because again, like your mission say, you support a coordinated system. Are you telling that story too? Just throwing that out there. I don't know if you are. And should you?
So I think part of being in that growth mode still, and in some places, I think just tweaking out a startup, is that unlike a really mature organization where at the top has the ability to be largely externally focused, our eyes are turned inward still. We're still trying to sort out a lot of those operational, especially administrative systems. Our business model is our business model. We're a tax-supported organization. That's what we are. So it's not so much about the revenue, but it is about the administrative systems that support allocation, that support data collection, and it's about looking at that data and deciding what it means, and setting targets for those things that are likely, and so which would help tell that story. And so I think part of our challenge is letting Marcia be able, especially Marcia, to be that have that external focus that allows you to then coordinate a system and support it rather than just be the funder of a bunch of programs that we are now loath to reduce.
So, although I'm not a member of the board, and obviously I have a lot of opinions, so bear with me, that I agree with Dr. Labarda that we are more in the early sort of growth stages, and that for me, I think the overall thing that hits the nail on the head is the systems, infrastructure, controls, and administrative side of how we operate, because we grew before our systems and our infrastructure was in place, which makes it hard to sustain. And we cannot grow and develop and actually get to the next phase to make that broader impact if we do not have the proper infrastructural support, systems, coordination, staffing. Additionally, something that does also stick out and I feel is a strain as far as when we come to the time for us to get voted again is, yes, we are a tax funded organization, but in order to show the public that we are not just utilizing taxpayer dollars, that we're actually leveraging private donations, fundraising, and doing other things to show that we want to increase our ability to impact the community is something that I would like to see. And I think that that will push us forward. And perhaps that might be a perceived strain for voters. Well, we can't ask for, we cannot do anything related. Okay, well, then never mind.
We can
Disregard.
leverage.
We can leverage.
And those kinds of things.
So leveraging opportunities for strategic partnership, we are not showing that we are completely 100% reliant on ad valorem taxes and that we are utilizing our resources in the most impactful manner, I think is the best way for in a public facing arena. But I do believe that our staff capacity is stretched, and that internally causes strain on higher level ability to not be in the weeds on operating.
One thing that Molly said, we kind of discussed in our group, and I brought up, that the trusted success, because we are the funder, right, is sort of tied to the success of the providers. Right, so we kind of got this shared story of how, and I don't know, and it just hit me. We can't fundraise, but they can. And we also could say part of telling our story, I think we might need to have, like, as part of a workshop of us kind of like throwing out ideas of how we tell our story. Part of telling our story is the resources that the trust has deployed or invested in organizations, and funding them has allowed them to show capacity to fundraisers, the grantors, other grantors of those organizations, that has given a lift to our community. So we're like kind of in this chicken and the egg type thing. We're building the plane while we fly it. Unlike the nonprofits who trying to get funding, we had a funding source, but we had no staff, had no systems. It was 5 of us trying to get going, right? 5 statutory members. And now that we've gotten going, we're trying to almost backtrack and retool the plane to say, oh, we got like a wing that's like 6 inches long on this side and one that's 18 over here. But we got to figure out a way of showing how what we've done with the taxpayer dollars that has really improved the community. Because I think we've had some impact. It's just trying to figure out how to tell the story without hacking out the people who aren't that effective, who are kind of like, might have to cut off a little bit. Yeah. So this, the problem that Ken said, so.
Tough decisions for sure, right? What my hope is that this gives you a framework, skill, the vocabulary to talk about this. Like, what is staffing? What does that mean if this wing is shorter than the other? What do we need to build that wing or make it more? What is that to recognize it? It's not just money, right? Obviously, you had the money, and then you had to build the other legs, right? So hopefully that this helps you identify that, so you can stabilize your table. Does that make sense?
I'll add, this organization has gone through 2 iterations of a strategic plan. And I haven't been involved in a 7-year organization that's done that. I mean, that's very impressive, for at least from a governmental organization. I would also say that I haven't seen an organization of this size that's able to give real feedback and evaluate programs like this organization has done. We've done some pretty amazing things that I think we need to tell the story about, communicate. But I keep going back to our mission is to coordinate the system. And so I think, that's really this board and Marcia's responsibility. And I'm going to use literacy as a great example. Literacy became a community-wide effort. Board, the library, the school board, this organization, and we're not funding it all, but we are taking in many ways a lead in certain aspects of that. And I think that's the kind of example that the taxpayers expected when we formed this trust. That's different job descriptions for Marcia and this board than when we first started. And I think that's what I see us kind of evolving into, so that we can tell that story moving into the reauthorization. And to Tina's point, there are programs that are really making significant impact. And them, one of the things we as a board were really frustrated about the first 3 or 4 years is we were funding all these programs and the programs weren't telling anybody that they were funded by the Children's Trust. Well, that's changed, right? But we probably need to coordinate communication of their missions and how it ties into the trust goals, so that we can leverage them telling our story as much as us telling our story.
So, couple things connected to that. One is, and I think Tina touched on this with the capacity of the nonprofits, excuse me, and what they're doing, how many more people they're serving, their fundraising, et cetera. And when Tracy and I were with the consortium, we would look at what we were doing, and we would also look at what our members were doing. And we measured both the growth or the change in both, and they're linked. They're inextricably linked. And I would think, I'm so sorry. I thought that my phone was off.
You have to go.
For you, so I'm going to go back again because I am getting stuck on that, a coordinated system of community services, and that would be maturity. That would be high level functioning maturity. But Tracy used a phrase about what is your distinctive competency? And I think moving toward what is our distinctive competency? We just talked about, when we talked about area 4 and the strategic plan and our members, and I brought up that idea that we get all these wonderful reports that I hope we'll use in communications and really highlight, and not just have it be a report that sits in our board book, but really look at it and dive into it. But I also think the providers can learn from it. And the coordinated system part might be, what did somebody learn that benefits others in the same community? Because we're all in the same community. It's like somebody could solve for, I don't know, a partnership with Uber and transportation. And if it's solved once, don't solve it 12 times, or don't, not share that. So anyway, moving in the maturity area on the finding our distinctive competency, I think is the next level to strive for.
So piggybacking on that, the other thing you stressed at the beginning when you were reading our mission is that it said support, not fund. And so our distinctive competency may be, how do you provide support that in essence coordinates that system? And so to me, that's kind of where we need to, if we're not just funding, especially if we have to cull the herd a little bit and not have as many providers, then what does that support look like? And we're doing some of that with CNE to help providers develop their competencies. But I think there's probably other ways that we can learn about support. And for me, I keep coming back as we tell this story to that triad of relevance, impact, and sustainability, that if we can, if our message can be these things that CTAC supports and helps keep coordinated are relevant to you, and we can show you not only that it's relevant, but that we've made a huge difference, then the sustainability, which is for us getting voted back in, sort of will take care of itself, right?
Yeah, and so I think one of the keys to that is what we're doing right now, and every provider doing this and completing this next year. So that, or this year, yeah, or by the end of next year, yeah. And I think many providers are gonna lean in and really want to, and many are gonna kind of resist that. And it's not a startup is bad and a growth is good. It's not that. It's just, where are you? Because if we're going to be the coordinator of systems in our community to improve the lives of kids and their families, we need to know, they need to know, and then we need to help them understand where they are. And I think that is capacity building. And when when our staff is able to say of our 80 providers, 60 of them are in startup. I don't know what the numbers are, but it's going to help us identify where we kind of reorganize our thoughts into the last 4 to 5 years of this funding, this terminal funding entity, unless it's renewed. Yeah.
Anyone else over there? Group is hogging the conversation. Not that my colleagues aren't wonderful, but I keep with the distinctive competency though, when we brought up literacy, and that we don't take the credit for solving for literacy, but for raising the clarion call and convening around it and prioritizing it. And I watched Marcia do the same thing with the early childhood, the childcare, with the Florida Chamber and with the children's movement. And to me, maturity looks more like that, like, raising the caliber, raising the issue, staying with it. Will there be another convening? Will we measure progress as a community? Not just of how many slots do we have in the summer bridge program of 65, but as a community, are we measuring our progress? And there's a lot to be said just for that convening role. Else?
I was going to comment distinctive competency. I think it started with this board. I think we have one of the smartest boards in the state. I think it starts with, I think it is added by, I know we have one of the smartest communities in the state, and we have all the resources we need. We don't have all the money necessarily, but we have all the resources. And so I think this board's distinctive competency is the amount of knowledge at UF, at Santa Fe, at all the institutions that are serving children, 0 to 18, working together to do things. Or I just have always said, I think the highest as far as level of each of these board members. How we communicate that?
Working on it.
She's on week 3, so let's give her 4 to 6 weeks.
I could say something.
I can say.
About all this discussion, but it's gonna be so easy, you guys.
Yeah, grab a microphone. Let's come talk to us.
I just copy it.
It's going to be real easy. We do amazing work here. There are amazing stories. I know personally so many of the providers from my previous work. I know how to get them to talk. I know how to get them to share from the granule, the people that they're helping, the children's stories, and how to connect that all the way up to the support. And the funding is the support, but you don't have to say that. You don't have to say that. The funding provides all of what is happening. So you do it through action, you do it through movement, and the stories are going to tell themselves. We just have to tell them to people. I'm super excited. I'm going to go now.
Great. Awesome. Okay. Stay tuned for week 4. Tracy, you may be getting to this, but you talked about with providers, different expectations at different stages of the life cycle.
Yeah.
And that this isn't punitive, or this isn't a numerical score or judging. But if you have 80 providers, what does that look like to have different expectations yet accountability? I mean, that has to be the rub for staff.
Absolutely. It's figuring out that system that you have. And if you have to cut some funders or, funding from some people or develop some more, what does that look like? And all in the context of telling your story, maximum impact, that kind of thing. I think that's something to decide. So I don't know what it looks like. It's going to be, I have some tools I'm sending you after this, but that maybe just for your staff to use or consider. Besides everybody doing the selfie and doing all that, it's, if you're truly, you look at your goal 4, empower and equip our provider and community, you're not just a funder, you are a systems builder, right? You're a systems builder. And next slide would say, so you need clear internal roles, consistent workflows, you figure that out. What does that look like? Adequate staffing for contract management and monitoring, and communication tools that match the scale of the work. Okay, so that's what, as system builders, going to come out of this selfie, and you're talking about it now. So all of those are reflected in the survey responses. So I also want to recommend, you can reread starting on page 115, it's at the end of the book. It's a couple chapters about how organizations like you, funders, work with other providers to build capacity. Just really good examples of what you're doing. You're not alone. You're not alone, that this can work, and really you can identify what you need, I think, what you need to show that outcome, show the impact in 4 years. I think you can do that. It is figuring out a system and making hard decisions maybe, right? So in this phase you're in the growth to maturity, boards help organizations slow down strategically. That's the next slide. While staff work to build durable systems. So that's where you're at. So board is going to slow down a little bit. Let the staff work on building the systems, right? So problems arise, and I've heard a little bit of this, when board feels pressure to respond quickly to external feedback. Staff compensate for systems gaps by working harder. Can anybody say burnout? And no one names that the organization has simply outgrown some of its current infrastructure. This is where the life cycle is like, okay, this is where we are. Let's calm down, everybody, right? We can work on this. We can build this. So a question, this next slide, what does the trust need to invest in now? What do you need to invest in now so that this plan is actually executable? I think that's, you're not going to solve that today, but what do you really need to invest in now? I think that's a good discussion point.
And I think then that includes not just funding in terms of what programs are, but also that fund balance, because if we do need to invest in infrastructure, that's where it needs to come from. And so, I think we really need to have a serious conversation about that fund balance plan.
I think when I think of invest also, I don't necessarily think about what we need to fund, but also investing in allowing the organization, the staff, and the board to invest in ourselves as it relates to intentionality and having time to really stop and think, what are the plans? We have our strategic plan. What are the necessary steps before we do, right? I don't want to fly the plane while we build it anymore. Y'all have worn me out doing that. So and so when I saw that, that's immediately what I thought, that it wasn't about where we're going to allocate, the dollars and the line item. It was making sure that this organization is prepared and we have what we need to then do the work.
Comment on this question?
Having heard what Christy just mentioned, I do think we probably then, on our agenda, the board should have a conversation in whole with staff to see what you all think you need. Tell us what you kind of need in a sense, because, the chair could be having those conversations with Marcia or may not be. Me as a board member, I have kind of like stepped back after I rolled out of the chair to kind of, because Marcia was new, trying to let everybody kind of evolve and blossom to try to grow into the new leadership. But it may help now that where we are now, that we hear some of what your struggles are with what our requests or demands are. Because this board really sits at a kind of a different spot, right? Like we exist, we're vote approved, so we kind of like we're in the middle. We're elected. I'm elected. Ken's elected, right? And we kind of have this thing where we gotta do work that convinces the people to this. You all in the middle. We don't do the work. Y'all don't do the work. Got to provide it. So we kind of all of in this, like you all in the middle with us at this interface. So maybe What I'm trying to say is maybe if you all tell us some of what your struggles are and what you all think you need, then maybe that helps us govern in a way to be able to answer this question here now. Yeah.
I mean, when I see, yeah, when I see this kind of plainly spoken, I think this board has spent every budget cycle figuring out what can we invest with providers? What providers can we fund to maximize impact? And this year is the first year that I feel like we need to be asking that internal question, which is why when our chair added 4B, I was like, oh, that's it. She got it. She figured it all out in, an hour and a half as a chair. Because what do we need to invest internally? What does our staff need internally to now fulfill the second iteration of the strategic plan? Does Molly need another bookkeeper? Does Christy need a piece of software? Does the program, does Benita need software? I don't know. What do they need? Tina just nailed it. What do y'all need so that the plane's built and now we don't have to worry about it coming crashing down? And no, this was a county commission. So we did a county commission strategic plan as we had done this 6 months ago. And one of the things that came out of that is we have 5 county commissioners and we have staff, and every one of the county commissioners was like, you're not the 6th board member staff because you're not elected, but man, we rely on you like you are. What do you need? Like, what do you all need? And I feel like that's what we're saying, or we should be saying to our staff right now is, okay, you guys kind of know where we are. You know what the strategic plan is. What do you need so that we can move from high growth into sustainable mature? If we're labeling ourselves, are you labeling us as high growth? Is that what this is?
Yeah. the kind
Yeah,
of
okay.
amount of high growth.
So I think that's wonderful. That's great.
So this is my comment to add on to what Cornell just said. Marcia, your job is to make it safe for your staff to tell you what they need. Figure that out. That's not easy. That's easy.
I think when you can move from a high level or, strategic plan into a real implementation plan, one of the questions that I think has to be asked is, if we're going to pull this stuff off, what do we really have to be really good at doing? What do we know? What do we need to know how to do? What do we need to do at a much more granular level? And then the next question after that has to be, and what are the resources I need to make that happen? And that can be people, technology, facilities, it can be any number of things, but that question of, in order to do this, what do we need to excel at, is one that we can't answer. And I think that's really what we're asking you guys to make sure that we know, so that then we can free up whatever resources and time, stuff.
I'll make it.
Please pulled out a piece of paper yet, though.
They got my phone down.
But this is making me wonder if there should be a section of board agendas where because to Christy, I hear you loud and clear. We're running from the next thing. Bonnie and Amy are evaluating the thing that just wrapped up. You're rolling out the RFP for the next thing. And then, we're pedaling along. If we don't intentionally write it down, that we want to help build structure of the organization and hear about it and the pain points, that's where the board could possibly help you. Even though Nancy laid it all in your lap, but we can help you think about it. And I think that's just as important as responding to the person at the podium or the dollars and cents.
Any other comments before we move on to kind of looking more at our providers and where they land in this? Right. So many of the challenges the trust experiences with providers, late reports, uneven data quality, staffing turnover, are exactly the same challenges the trust is naming internally, right? Just at a different scale. So think of yourselves as them. or them as you. You're all struggling with these internal systems. Not ready for that yet. A provider can be delivering excellent services, I think I said this before, aligned with the trust's goals and still struggle with data systems, financial reporting, staffing, stability, or compliance timelines. And that doesn't mean they're irresponsible, right? It usually means, again, program maturity has outpaced their organizational infrastructure. I want to do an exercise. I'm going to give you a scenario and have you talk about it and think about a couple of questions. So let me pass these out. So I think it's the next slide now. So on the first page, there's a scenario of anonymous. Any resemblance to any existing nonprofit is purely by chance, all that disclaimer stuff. So that's kind of the scenario, existing nonprofit. In the back, there's some questions I'd like you to think about with your group. So.
Everybody finished? Looks like everyone's done. So let's walk through what life cycle stage do you think Bright Futures Family Services is at? Growth, startup growth. Back and forth, growth. All right. How do you know? How do you know? How do you know? Got it. What? Okay, what about deliverables and capacity? What trust grant deliverables are most difficult for this organization at this stage and why? Outcomes. Reporting. You act like you know something. You've done this before.
But they know their kids are coming and that their kids want to come. And so we know they're worthwhile
Right.
because
So then that's what support strategies might they need? Not necessarily from the trust, but what would they need to develop in their life cycle? Systems in place.
I'm used to doing everything. I got a single job and I'm not sure I'm happy. So it could be either, I think a good consult to help them are and see where they.
Yeah, we wondered about organizational development. Talked about that too, a near peer mentor.
A neutral consultant, so that there's a firewall, so that whatever that I mean, I think that's an important piece that.
What strikes me is kind of being in your situation with working with Ed Foundations around the state is what I would go to is they need to learn what an outcome and an output difference in the results are. That's what I would go to. And then you look at all these underlying things that are causing them why they can't do that or won't do that. So that's the interesting thing to me, that nobody said that. Because that's what you really want. You want those outcomes. What's your impact? Show me that you moved the needle, but nobody said that. So it's. There are limitations on why they can't do it. It's my understanding. So then the question is, what shifts when we interpret behavior, their inability to report outcomes, through a life cycle lens instead of a compliance lens? Shifts. Right. And right.
He personalizes it. And
that comes, your systems builder comes in, right? Where we have to help them build these systems or support them in building these systems.
If it's a really valuable provider, because as Mary said, the kids are coming, the kids are obviously benefiting, then it's incumbent upon us to help them fund, because one of the squeezes in growth is it all costs a lot. You know, infrastructure building isn't cheap. And so if we really think this is a valuable entity, then we ought to be willing, and obviously. But I think that just highlights the importance of making that accessible and saying, no, we are investing in you becoming better through this mechanism.
I want to know what Amy and Bonnie think. All of it, but particularly the deliverables and capacity.
I mean, we're pretty we're pretty clear about what the outcomes are. Like, I don't think, like, because we do the performance measures with them, but I think what is something that they could be struggling with is getting it in on time, getting in what we asked for, filling out the monthly reports in their entirety. So that is definitely something that we deal with, not necessarily not knowing what the outcome measures are, but kind of maybe even not really totally getting how to fill out the monthly report, or not understanding I don't know, maybe even where to get the data, but I feel like we talked to them about that. But what did we say? Do you want to?
Well, and
She wrote it down.
part of it, the thing is this, they dedicate all their energy in the program and none of it to the administrative functions. They have the program staff wearing all those multiple hats, and really what their heart is in is serving the kids. And so it becomes an afterthought, and it's late, and they don't want to sacrifice doing the work with it for entering the data, which they see as less important.
And at the end of the day, the person you trained may not be the data.
And it's
the
the
person
different
who ends
person.
up trying to fill it out that month.
Yeah, sometimes we meet with the CEO, but then the person who's actually entering the data will be somebody different. Sometimes it will be the CEO, though, for some of our organizations, is doing everything. They're driving the bus, they're teaching the classes, they're meeting with the kids. But so what it screamed to me is there's not they don't carve out time for the administrative tasks, and that's why they're falling late and behind. It shows that they have some competence in it because they can do their attendance and they're meeting their numbers, but maybe they're not having enough time for all the stuff, which I wonder if we put out the idea of, hey, have an organizational development consultant, if they would roll their eyes and say, ah, another thing to do. Because that's what it feels like when we work with them. Sometimes it's another thing to do, and it's a good thing to do. There's a greater gain, but
They might. I mean, it also sounds to me like they need more staff. And so again, the question is if they come to us and say, I want to be compliant, can I fund, will you fund another person? Can I increase my budget to fund that? If we're viewing it from a lens of growth rather than compliance, do we do that? Do we take a look at that?
Do you ever get questions about like shared services, or do you know somebody who could help me with bookkeeping or reporting?
We have our partnership with Community Foundation and CNE, and that's how we've done a lot of those things. But we also, we as staff, we spend a lot of time assisting providers. We spend a lot of time with their organizational capacity. Most of us, they've gotten to know, so there's a level of trust. They may reach out to us before they reach out to somebody else and just kind of ask opinions. So we do a lot of that, and I don't think it's punitive. As I was saying to Marcia the other day, fortunately, we don't have an executive director that's like, get your work done, get your work done. Like, we do have space to be able to work with providers.
Oh, please, microphone.
Talked here, when we discuss support and strategies. And this is just personal, what I see sometimes, when you're trying to assist people, and I'm sure to me. Yes, sometimes it's staffing issues for sure, but other times you sense that this organization is in need of coaching, just like whether that's executive coaching or just organizational kind of human capital, looking at how they're using their people. And, like any organization over time, just like us, they get used to a way of working, they develop relationships, blind spots, and sometimes, but I get, I get situations where I want to or wish, and Demetra can know that too, because she'll say, no, you can't do that, it's not time. Or I want to go out there and sit down with them and have them show me how they're doing it and provide them with that extra level of support. So when I saw that question, support strategies, beyond the coercive, what can we do? That's what comes to my mind, is having those people that do have a background and some expertise in helping nonprofits, small nonprofits, figure out how to, because they're always going to be short staff, they're always going to be high turnover, but what are you doing? What do you put in place to at least continue the best you can to not have that prevent your reports coming in 3, 4, 5 months late and stuff like that?
Thank you for sharing that.
I'm having a deja vu moment of when I was an Ernst & Young auditor back in early 90s. And what we would do before we did any audit was document that entity's systems. How did cash receipts work? How did cash disbursements work? How did payroll work? How did, income work? Yeah, you actually document, you flow chart, and then you are able to establish if they have effective controls or where their weaknesses are. And I wonder, as we go through this and each of the providers do their self-evaluation, if one of the things that we as an organization should think about is going through that process at the beginning of a contract awarding, where we go in and we actually understand how are you going to, like in your systems, process the information in the SAMIS that we need to report to our board and the taxpayers for the money we're giving you. Like that that upfront time of documenting that, if that's even able to be done, so that we can then, and maybe we do that, or Marcia's sighing, are we doing that already?
No, I hear you, but we can't get contracts done now.
Question. So I know when Bonnie and Amy and I usually meet with them when they're new together. And a lot of what we do ask is how do you, and then we do give them advice on how to streamline. So there's a lot of development, I know, especially with the performance measures. I'm just a helper of both things. But we do they are asked like how they do it. We don't operate under the assumption that they absolutely know what we want and how we want it. We do ask, we do have a lot of conversations about that. And then as I am passing them off to fiscal and helping them with their basic entry, I do ask that they think about how they're going to gather the things that are necessary in order for them to document. Like that's a discussion.
Yeah, it's actually what systems do they have in place?
More in depth.
Yeah, I mean, we ask that too. And if they don't have something, we suggest it.
So one of the things that I wonder is if we can't have a resource library of template procedures, like how do you reconcile bank accounts at the end of the month? How do you, so instead of saying, how do you do this? If it's clear they don't, and instead of saying, here's some suggestions, just here's a whole policy manual or procedure manual section on this kind of accountability.
That's supposed to be what we would be having C and E.
Yes.
I said C and N. C and E.
But there has to be a loop so that they know what this particular organization clearly has not been able to do, and so that we can close that loop. A lot of these startups that I've talked to, and Tracy, I'm sure it's the same with your experience, they went from mom and pop, their brother, sister, and favorite uncle giving them a check and not having to account for how they used that money because they were doing God's work with it. And that's how a lot of these little nonprofits start. And it is not an uncommon way for them to start. And we're moving them from God's work to government.
Right. Literally. Yeah.
Yeah, Satan's work, right? So I think we need to be mindful of what a transition that is. I'm doing good and you're just putting all this stuff in my way.
Yeah.
And I think that, we've been doing good work. We get praised for doing good work. And now you're telling me I'm deficient in
Right.
all of these ways.
And it becomes adversarial.
And it becomes adversarial, and it feels like the trust doesn't really want to help. And so I think if we step back and get this out of the personal and have the resources and make sure that the communication to CNE is better than the communication from, in other words, that firewall, so that they know that it's safe to be open and disclosing when they work with CNE, can help with that. And just having a resource library of policies and procedures that they can just adopt, and if they follow them, no matter who's entering the data, they'll have a step-by-step guide written out for them.
Don't you do that? Don't you have some kind of, yeah. So I think we're
Yeah.
doing bits and pieces of that. I'll defer to Molly because she had her.
No,
I just know Christy was saying, I don't know who said it, but someone over here talked about, being the trust being able to fund an additional person. Are we hearing you say that there is flexibility for us to do that? If we know that
Yes.
there are,
Yes.
okay, that we need to know
I'm
that.
saying, give me a budget that fully reflects your ability to do the work we're asking you to do. And if the work we're asking you to do includes a lot of this administrative stuff, then by golly, we got to fund somebody. We got to let them include that cost in their budget.
I would add, I am for funding resources that take us from high growth to early maturity. That's how I would say that, because you may say a person, you may say a piece of equipment, you may say software, and I'm about getting to that stage where we can help each of the other providers move from startup to growth, growth to maturity. And I think we have to invest internally in the resources you all are telling us we need, so that we're not continuing to build the plane in the air. That's what I'm hearing.
I think sometimes as the programs, what I see is a program when they first start out, they do this budget and then they don't really realize what they need. And then the next year they'll come back and then they'll have a better understanding. So sometimes it's just that startup, they'll put the budget together, not realizing, oh, I do need another staff person, or I am gonna need, another one. And I think the longer that I've done, they're locked into it.
Because it's a 2 or 3 year. Yeah.
But that's just moving money, that's not adding it.
And I think, again, if we're doing what you all are saying, and maybe we need to do more of it, like how do you sign up new people to the program? Understanding their systems and then how their systems report into our systems. If we're doing that upfront work, then we may be able to identify, you're not going to be able to report to us on time because you've never reported to us on time, and we know how that works. And so you use QuickBooks and you need to be using Peachtree. I'm just using that as an example. But I think that's kind of our role when you go back to our mission as the convener.
And to your point, I think maybe not doing it in the beginning, but at the end of the year may help instead of us starting at the beginning of the fiscal year. At the end of the fiscal year, let's do that assessment there so they will know when they get ready to renew, okay, this is what you need. Because pretty much now I can tell when it's coming, I'm like, yeah, I'm looking at the budget, I'm like, yeah, this is not gonna work. So already helping them to do that assessment at the end of the year to prepare them for where they need to go.
Additionally, in support of that statement, I feel where we have an opportunity and where we're planning for improvements in the future of how we can better support the provider community and their growth and move the needle for them is for us to have the opportunity in the next year as we are going through a process of recalibrating our internal processes and procedures and how we handle things, having the opportunity from a financial perspective, because that's what I can speak to, is actually going on site and evaluating their systems, sitting there with them so we can get an understanding, which is what, to Ken's point, in general, that auditors do, and that's what we from a financial perspective should be doing to ensure that we can receive the data and that we can impart to them how it should be done, do those kind of checks, and that will help move the needle. And to Belita's point, that may not necessarily be at commencement, but it could be, I believe in the following fiscal year, that is going to be something that is quarterly and on site. And I think that should help to augment. And then we can, as we go, just like with the strategic plan, keep them apprised of their progress and help them restructure or pivot so that at the end of the year, when we're coming up with these CQI commentary, that it's not such I don't say a slap in the face or a surprise. It's more a compliment sandwich, as I like to say. The good, something they could use for improvement, and then another positive statement so that we keep the providers feeling we're a trusted resource. But at the same time, we are also doing our due diligence to support them. And in turn, by helping them, we're also helping us.
I have a question for you. How many providers, when you first funded them, had solid table legs, all their ducks in a row, systems and staff aplenty, and they were just waiting for the funding to come? So the thing I want to say is you're probably stretching them to grow, right? You're putting them in a different category or stage, if you will, right? Just like we did with the state funding at the consortium. It put us in a growth stage that made us, wow, we got some systems work to do, et cetera. So think about that too. It's like they got this, wow, this funding, great. This, oh my, look, think of what we can do with this. Not really understanding that they're not ready, but you might know. You might know, or can understand that you're pushing them, gentle pushing them to be a better organization, right? So.
Making me wonder, bring the providers together and you share. But in that sharing, there also be a segment. Let the person who has figured something out share it with their peers. Did I do that? Okay.
We give them time to, especially Bonnie has her shining stars, and we'll say, can you share what you did to be able to get your data? And then they will be, they can convene among each other so they can talk about best practice. And I think that's a lot of times where those shared resources come up. They may have, oh, I have this bookkeeper, she gives us 20 hours of, can we use, so they do have that time to do that.
Not received, I mean.
Those who want to, they will, and those who don't, they won't.
Yeah, we can't, it's their organization. So beyond having a contractual deliverable, we can't force some things on them. We,
And you
yeah.
can't force a growth mindset.
Correct.
Yeah.
And you have to want to receive the help as well. We would love to help everybody and we would love for all of them to succeed, but not everybody is going to be receptive to some of the hard conversations that may come out of that. They know what they're doing. They got this.
Yes. Yeah.
Well, you need to fund organizations that can do good work, right? That's your bottom line. So if they're not willing or whatever, I mean, that's just me. It's like,
So like when you say that, and I'm listening to Demetra, because what I don't want to get us to get into, we want people to have a growth mindset, but I want us to be real, not that we handle providers with kid gloves, but I don't want us to develop a relationship, oh, you're gonna do this because we holding a purse string, because that was the impression of this organization initially, that we treated people like crap because they were coming to us for money. And these are the people who we're gonna have to appeal to for them to vote for this. So I think there's this balance there. We want them to do good work and we want to support them, right? But I think we have to, like I said, I want us to be real careful in how we present our help and the tone in which we talk about it. Like I kind of like, I don't want to sound like I'm getting defensive for them, but I am getting defensive for them, right? I'm gonna be the voice for the people who are here, right? So like I often say, when children don't come to school, there's something not right. Let us not approach it as if we're blaming them. Let's figure out what it is, like on our part. Let's own some of this ourselves as a school district, right? So I want us as the trust, I try to tell people in my ambassador when they call me, look, this taxpayer money, we just can't give you this money. I talk to them, like I would, I go right back to them, right up, like I would talk to them on my front porch in my neighborhood. So there are certain things we have to do, and these are rules for this right here. And I've left many conversations where they're good in this. They don't like my answer,
But they understand.
but they understand why we have these limits. That's all I'm saying. That's what I'm saying. Okay? I'm not saying give grace. I'm just saying you can give grace, but if you tell them I'm giving you grace, they're not going to receive that grace.
Right.
That's
Right.
that's all.
Right.
I'm just telling you what I'm hearing. I'm just telling you what I'm hearing. That's what I'm saying, and I don't want that to be.
Sure.
That's all. I'm one board member. There are 9 of us here. The other 9 might not feel it that way.
But you are accurate in your statement, and I think we learned from some experiences in the past, and I think there's been a shift, if you will, and there's a lot of relationship building, right? And so when a provider calls, we've already, even if they're asking us for something we know we can't give them, I respect you enough to where we're going to get on a call. You're going to leave with resources or additional information or a contact, even if I tell you no, because you're absolutely right. I remember you were getting those calls, right? I know you were getting them.
And I was in the
even
middle
if you
trying to like say, look, she just trying to do her job. And I was really not trying to usurp you guys' authority. I was really trying to build the bridge to let folks know, look.
Correct. Right. I honestly think there was a shift in
and we grew, right? There may have been 5 of us at one time receiving the same request. And so by the third person, it was like, we cannot get, no. But I think there was a lot of growth that took place internally. And so we're able to have those conversations with them. Yeah, no, absolutely. I hear you loud and clear.
Well, and I think, and I've had this conversation with you guys. I think it's an iterative process, right? Where we need to refine what's really essential for us to know in order to document the impact that we want to document. And what's important for us to know as a trust to make sure that our money is well spent. You know, I'm a big fan of materiality. Don't bug me over $10, you know. So what's really material? What is the essential thing that we need to know, and streamline those data requests and that information request to what's really critical. And then yeah, you know, at a point, there's accountability, and there just has to be accountability, but it goes both ways, right? They need to have the development and the skills and the support to develop their infrastructure, but we need to be sure that what we're asking, because when I still hear you're harder to work with than the feds, it's like I want to crawl under a table because I don't know what to say about that. I've worked with HUD, and anybody who wants to tell me that something's harder to do than that, and I go, oh God. So I
But
think there's both
sometimes you
sides.
also have to say back, well, the feds didn't give you money.
Well, true. No, I'm not.
So, I mean, so,
Yeah.
so I mean, I think a lot has changed. I agree.
I think that's the whole reason for the nonprofit life cycle approach, for sure.
Couldn't even be having this conversation if, right? So, yeah, we're definitely moving in the right direction. And I think everybody's saying the same thing.
Molly?
One last thing I like to say is that I could agree and hear with what everyone's saying, and that was a big thing that I think, at least on my side of the house, coming into is augmenting provider relations and teaching to be provider-centric in a positive and empowering way while still holding accountability. So there's a way that you can speak and converse with people, or I will get on the phone from the financial side with providers, and they might not always like the answers that they're hearing, but at the same time being responsive, having what I'm calling office hours or availability for them to meet one-on-one, share how they feel, receive it. I might not necessarily agree with it, or we might not agree with it, but be understanding, aware, and communicating to them, and doing it in a positive way, and being encouraging even when you have something, I don't want to say negative to say, but even if the answer is no, there is a right way to word it and verbalize it. And I think that communication is key on all parts, and I feel, at least it seems like everyone has come a long way. I haven't been here a long time, but I think that's where the finance sector is improving, or where we're working very strongly on communications, being provider-centric, being positive in our communication so that we're augmenting our relationships and rebuilding our reputation in some ways.
We're all on the same team, us and the providers. We all want the providers to succeed. So I think, going into meetings, like difficult meetings like that, and, how can we make this work? Yeah.
So the last thing on this slide, like life cycle thinking doesn't remove accountability. It makes accountability more effective. And that's what I think. So I'm going to close out by kind of reiterating what we all just talked about. Your strategic plan positions you not just as a funder, we talked about, but as a steward of the local child and family serving ecosystem. You can switch slides. So that means exactly what you said, aligning expectations with organizational readiness, pairing funding with capacity support. You got to have both. And being clear internally and externally about what growth actually requires. So just exactly what you were just talking about. So as you move towards your finalizing your plan, just some questions. How does your own life cycle stage inform pace of implementation? How might life cycle awareness shape funding structures, reporting expectations, and technical assistance, what we kind of talked about? And what does it truly mean to support growth well for the trust and its provider? So just thoughts, don't need to discuss them any further, but thank you for letting me be here and being part of this discussion. It was really great, really exciting.
Thank you, Tracy. Tracy, do you, not to put you on the spot, but what case study did you suggest we go back and read? Because
Page 115.
Value-added investing?
Yeah, I think it starts a couple chapters in there, talks about different, like one's a community foundation example. So.
Tracy, thank you for walking us through this. You know, this board, and I'm speaking to my colleagues, we spent a lot of time on our strat plan, like twice. But this hour session, at least for me, was as good as any of them, because now we're talking about implementing. And we can, you know, our plan's only as good as we implement. And basically, I think this has been invaluable for our organization. And I know that our providers, at least the ones that are really tuned in to what we're trying to do as a community, will embrace this process, because it's been really effective for me as a board member of this organization. And I hope that the ones that really embrace this, so we can really help them.
I mean,
I think it's really, really great. Thank you so much.
it's-
Yeah,
it's
and Maggie
exciting.
for bringing this forward. I mean, this was, both of you, thank you all for really championing this.
Thank you, Tracy. Yeah, it's been fun to watch the books get picked up front and every time I come and sign checks. Thank you. Else?
Oh, yes. Where's this thing? I'm about to pick up my fan. Yes, so as Darlene.
Chair Cordell?
What's staff's thoughts for how we're asking the providers to go through this process? Have y'all shared that with us?
So what we decided to do for now is we are giving every provider 2 of the books. There's a letter from me that states we are looking to do more with the nonprofit life cycle process. We want them to be aware of it. We're asking the book to go to their CEO or executive director and their board chair for now, and that more information will be provided to them.
Staff's thoughts for what more information will be provided to them?
Well,
Like,
that
when are
will-
we gonna ask them to do it?
Like, right now, are they negotiated the 26? Well, I forgot. Yeah, they've already negotiated the
Yeah,
contract. for
so
26, 27.
remember, this is for 27. So what we wanted to do was do a soft rollout in 26. So we're starting with the chair and the board, the chair and the executive director. We are going to get with our facilitator to see if we can't pull together and do a webinar so that we could talk about so it's a soft rollout. They'll hear about it several times, and then we can start the
See how she
process.
handles her teenagers classmate from
Well, here's the
1984.
thing, what we don't want to do is, what we can't do, we can't legislate that they do anything if we haven't put it in contracts yet. We also don't want to, if we really are being provider centric, you don't want to say, hey, you have to do something. You want to give them the opportunity to start hearing about it, hear what we're doing, where we're going, how the trust is going to use this information to help the trust, right? So that's why I say a soft rollout. They're going to see what's going on with the strategic plan. They will hear what we come back with in terms of goal 4 and how we will utilize this information. And then as we start having webinars and being able to pull them in, they'll start asking questions, and we will be able to then say to them, next year, this will be a part of how the trust wants to help you. Because at the end of the day, that's the purpose of all of this. It is to help them.
Just make sure that you sweeten the pot by saying, with this capacity building, we want you to leverage the money you get from the trust, get money from somebody else. And to do that, you've got to have these processes in place. And we're going to help do that.
And I think like everything else, you're gonna have early adopters who are gonna go, ooh, this sounds really cool, let me do it. And they can talk it up and bring the laggards. At some point, if somebody says, I don't want to do this, I don't know that you can force them to do it in a meaningful way, number one. And so if you can't, you know, what you do is you say, listen, you've been unable to comply. We don't think you have the systems in place to be able to do this. We want to help you do that. But at the end of the day, the accountability is there. You got to get your invoices, you got to get your data. We're trying to help you get the systems in place to do that, but you need to understand that this requirement isn't going to go away. So I think you're going to have, you do a gradual buildup, and hopefully your early adopters will help sell it to the, and then you're always going to have some who don't. And if they don't, and yet they still can't do what they need to do, they can't do what they need to do.
I'd love to know who the early adopters are.
Okay, we can share that for sure. Oh, man. So as we had our conversation earlier about the strategic plan, I would like to ask the board if you all are okay with us not bringing it back on February 9th and bringing it back on March 9th. That gives us a little bit more time to do some more internal work, if that is okay with you.
Art, you okay with that?
Thank you.
Better good than fast.
Yes.
Do you want to share anything about the annual report? or-
Yes, you all have a copy of our annual report. We are extremely pleased to have this document. We will be saturating the community with our annual report. Thank you, Darlena. Thank you, Christy. Thank you, Emily and O'Malley. The team put a lot of work into this annual report. And remember, we did not have a director of communications for what, 6 months? But we had the statutory requirement to get our annual report completed and out by the end of the year. It had to go to the BOCC. So Christy stepped right on into the gap, said, I'll handle it, we will get it done, and we did. So I just want to say to the team, thank you, thank you, thank you, you all, for all of your hard work. Christy, as always, gets my gold star because she just fills those gaps. So thank you, Christy.
Yeah, I would just say I sit on the library governing board, and Shani's annual
Got
report
hers today.
is unbelievable. And I am proud to say you have met the bar. This is amazing. Flipping through it during this meeting. It's really job well done by everybody. Thank you.
Just FYI.
One more thing. I love how the CFO says, oh, debits and credits, those are easy. I really love how the communications person says, oh, we can tell your story. That's easy. That's awesome. So welcome aboard. This has been a great meeting. Sorry I was late, but it was great. Y'all caught me.
Yeah, thank you for showing up, Ken.
I know.
And he's already kicked us off his calendar. No, I just.
Latoya said, we don't know why. All of the trust things are gone.
Off?
They all fell, but I'm happy to report that she's got it fixed and they're all back on.
That's interesting.
I was my debits and credit person.
I just wanted to add that Mary and I will be traveling to Tallahassee tomorrow for the FACT fly-in. So we will be giving you all a report at the February 9th meeting on how well that goes.
Any other comments? And welcome again. Thank you.
I'm
Oh,
sorry.
yeah, and Christy, yeah. Any other comments from anyone? All right. Thank you so much. Meeting adjourned 4:20. Are we ahead of schedule?
Yeah.
No. No, I'm blaming Ken.
Thank you.
So much for. Very insightful. At least I know on our. I see it.